Welcome to Armchair Expert, Experts on Expert. We are joined today by Dr. Mary Claire Haver.
Wow.
This is a long time coming.
Big time.
Armchairies demanded it, and we have produced it. We actually leaned on Armchairies to tell us who their favorite menopause expert was.
Yes.
And by unanimous, popular,
Dr. Mary Claire.
she popped up, and she fucking delivered. I love her.
I thought she was so great. This is so informative and helpful and needed. And I've brought this up, obviously, to a lot of my female friends.
What was the main thing you said? Because I brought it up to some people, too.
Oh, I'm just like, guys, we had a menopause expert on. It's really intense.
It's very positive. It's like the most hopeful.
It is. I was overwhelmed.
Okay.
In a way that I needed to be overwhelmed.
Just
where like there's a
hear
lot.
everything coming your way.
Exactly. There's a lot coming / here.
Yeah.
And there are real things to do. And so I got to do them.
I've been telling people about the topical vaginal rub.
Sure.
That's what I was most interested
in. Yeah, we learned a lot. We learned a lot.
Okay, so Dr. Mary is a certified menopause practitioner from the Menopause Society. She is a board certified in I said this in the
it's
episode.
Hard to say.
In obstetrics and gynecology specialist, and a certified culinary medicine specialist and a best-selling author. 2 of her books, The New Menopause, which is hugely successful, and The Galveston Diet. I urge everyone to follow her on Instagram. She has really, really great videos that will be addressing all these little things that pop up. And also, you could go to her website, thepauselife.com, which is a comprehensive approach to menopause education and support. This was awesome. She was rad.
Yeah.
Yeah.
Enjoy.
All right, enjoy.
He's an armchair expert. He's an armchair expert. He's an armchair expert.
Lingua franca? What is it?
Lingua franca.
Lingua franca.
So they hosted my book launch, so my big New York, one of the deals. And she made this for me.
Will you wait 39 seconds?
Absolutely.
This is so nice. I feel left
Let me
out
see
because
it.
I do
Don't.
indeed.
The mic is, don't hide your magic.
Don't
I love
hide
it.
your magic.
I'm told it's a Wicked reference.
It is.
Yeah.
And the colors
green.
are wicked.
Yeah. I'm going to a Mardi Gras ball that is Wizard of Oz wicked, theme.
Oh, in New Orleans?
In Galveston. So
I love Galveston.
You've been there?
I have. There's a really unique...
There's 3 people, and he's one of them. Yeah.
I used to work for General Motors, and we had a car show there, and our ride route ended there, and we stayed at a very cool hotel, and each room was kind of unique. You know the one I'm talking about?
So that's going to be the Galvez, more than likely.
Okay.
Ooh,
very
nice. On the water, old.
Mm-hmm.
Yeah.
Yeah, very old. Felt like vampires would stay there.
Yes.
Yeah.
That's it.
And you guys moved there. You're from Louisiana.
Yeah, I grew up in Louisiana, went to undergrad I was a Raging Cajun, so
Nice.
at USL. I'm dating myself. It's now ULL. They're fancy. And then I did grad school for a little bit, went the PhD geology route.
Oh.
Geology.
My undergrad's in geology. I went to work for an oil company. Wow. Kind of had a change of heart and was like, what else can I do with this science degree? And I was moving towards the PhD, and I'm like, if I'm not going to do this PhD, I need to do something kind of cool and big. And
Yeah.
so let me just take the MCAT and see what happens. So then LSU for med school, which was in Shreveport, North Louisiana. And then I did residency in Galveston, and we've kind of stayed in the Houston, Galveston area, pretty much since then.
Do people tell you look like Courtney Cox?
Yes. Especially back in the day.
Yes.
When she was on Friends and all the things, I was a resident, and we would have friends watch parties, and what did you do as kid, back in those years. And so, I've always been told. Now it's kind of Tina Fey, anyone with black hair and big glasses, it's me. So.
Well, both are compliments.
Yeah.
Oh, we love them both.
Yeah, we do.
Yeah, huge fan. You're one of 8.
Yeah.
What did mom and dad do?
A lot of sex.
Well, clearly, yeah.
Oh, good for them.
Yeah.
They weren't shy about it. I would walk into the parents, making out in the corner. And
Really?
I was like, stop, but no. So mom and dad were restaurateurs.
Oh, yes, they owned a Cajun restaurant.
Yeah. So, we just called it food.
Right.
You would call it Cajun.
I
And it
would,
was
yeah.
a little more upscale than, it was like
Nice.
steaks and seafood.
Yeah.
And I grew up in a big restaurant family, though. All my grandparents, my aunts and uncles, most of my siblings.
That's why they couldn't keep their hands off themselves, because restaurant people are they party a lot and
They
they're
party
horny.
a lot.
That's a whole lifestyle.
Lots of naps.
Yeah.
I'm convinced.
Sure.
They work the lunch shift, come home, nap.
Nap quotes. How do you choose
OB-GYN?
Yeah, I want to say obstetric.
it's a
a hard word. I
yeah.
can say obstetrician, but
Obstetrics.
Obstetrics. That is tricky.
Obstetrics and gynecology. So in your third year in most traditional programs, the first 2 years are just in classroom and you get a little taste of different things, but you're mostly just getting the basics down. And your last 2 years are out in the wards where you're in the hospital rotating and kind of figuring out what you want to do.
Yeah.
I remember I thought I wanted to be a pediatrician. I was like president of the peds interest group, what they call PIG. And I did peds first. And I realized quickly, I love babies, but I don't love their parents. Like the whole dynamic, this is not my niche.
Yeah.
So then, you rotate through surgery. I really liked aspects of surgery, but I didn't like surgeons. They were kind of
They're
assholes.
very arrogant.
Yeah.
No.
So then ENT was cool, but like super competitive. I had the grades, turns out, but I was like, and then my last block was OB-GYN. And that first night I delivered a baby. I caught a baby.
Oh, on your first night?
On my very first night, the block I happened to have first was labor and delivery.
Yeah.
And, I'm like in there and, I have some like awesome upper level resident who's like, we got this. Come on, get in there. And I was like, ugh. And I remember calling my mom, like, I finally figured out what I want to do.
Yeah.
I want to deliver babies.
That's
I didn't want to
awesome.
have anything to do with menopause, but
Yeah.
What part do you think was so rewarding?
I still could cry. It never gets old.
Yeah.
Being there
Yeah.
for a birth. I'm assuming
Well, I
you've been
wanted
there
to
a couple
dial in on it
times.
because, two of my favorite experiences on Earth are the second both of my daughters were born, holding them, looking in their face, and going, "Welcome to Earth!"
Yeah.
Like there is something so
and
crazy.
I get to see them before you.
Yeah, right.
And
You're
I'm
first
just
on
like,
the scene.
come on. It's never gets
I mean, it's a
old.
miracle.
seeing
Like,
And
it
I make a
is.
big production. We lay the baby on mom's tummy, and I let the daddy cut the.
Yeah.
He gets to cut the cord,
They
and
give him something to
everyone's
do.
crying, and through the whole birth labor process, I'm hanging out. Where'd y'all meet? Let's talk.
Yeah.
Because you don't get that connection in a 15-minute visit.
Yeah.
All through the OB stuff.
Yeah.
So I'm there for delivery. I'm not just rolling in to catch the baby. I'm there for the whole labor. And
You're also getting to be a part of the most intimate thing that a couple will share, or one of
Yes.
them, for us, for sure.
Yeah.
Like, oh my God, we made a thing and it's here. That's a great,
It was.
as opposed to like a meter maid who has to give people bad news all day.
Yeah.
This is like, you're kind of,
The opposite.
yeah,
for
you're
sure.
with people on
and
their most.
there's occasional bad outcomes and
Yeah.
tragedies, and I'm trained for all the crazy stuff that could happen. But most of the time, you could probably go at home and have it, but I just get to be there, and it's just such a cool experience. So that's what I fell in love with, and I'm
Yeah.
like, and I have to do surgery, and I have to do this menopause thing and do gynecology, but it's a necessary evil to like do this baby thing.
Yeah.
So this menopause thing was like a sector of it.
Yeah. So,
not even, right?
Not even. So in medical school, right, we do
Yeah.
4 years, 2 years on the books, 2 years in the wards. And we had a 1 hour lecture in that first 2 years of like, this is menopause, just a basic overview.
One hour lecture.
Okay.
I'm not shocked. I know almost nothing.
That's why I'm
You
here.
know,
I got
yeah,
you.
exactly.
And you pointed out, and this isn't my realization, but like, we're going to do 1 hour to address a third of a woman's life.
That
Exactly.
100% of women
Yes,
will go
every
through it.
single. Exactly.
It's not optional.
And it's not a couple weeks or a couple months. It's a third of their life we're going to just not worry about.
Yeah. So,
Wild.
but it wasn't put to me that way. It was like, this is just a transition and, estrogen declines and off you go. You know?
Yeah.
And she might have some hot flashes, and we've got some to help, we've got some medicine for that. Okay. Then in OB-GYN residency, which is women's health, we have probably 55-60% of what we did was to do with OB, right? Getting people pregnant, staying pregnant, unpregnanting them, all the trials and tribulations of, all the amount of time, important stuff. Like I have just so proud of everything I learned. And then everything else gets shoved in the box of gynecology.
Yes.
And we have reproductive endocrinology, which is basically endocrine stuff that happens, weird chromosomal things, and getting people pregnant, right? Back
Right.
to pregnancy for fertility issues.
Yeah.
We have pediatric gynecology, so like how to take care of smaller people with the same organs who have issues and need help. We have general gynecology, woman exams and all that. And so menopause was part of our REI block, reproductive endocrinology, which we only did second year for 6 weeks. And we had a 1-hour lecture each week. So I got 6 hours. So in 8 years of medical training and education, I had 7 hours of menopause. We had no menopause clinics.
Yeah.
And then I was leashed onto the world, go be free and practice. I didn't know anything.
Yeah.
You've come to regret how many women were basically asking for your help. And in that paradigm, you pretty much were just turning people over to different specialists, right?
So I didn't know enough at the time to know that her palpitations, her frozen shoulder, her, myriad.
shoulder?
Oh, girl, wait, we're going to get
My
there.
mom. Oh, no.
yeah.
We gotta get
Our
on
laundry list of complaints, I'm the well woman examiner. So I'm like, okay. And I got 15 minutes to get through this, right?
Yeah.
So I'm like, check. Okay, we're going to send you to cardiology for your palpitations. We're going to go to the ortho for your shoulder. We're going to, so I'm giving her 6
See a
referrals.
sleep specialist for your insomnia.
Yeah, and a nutritionist for your weight gain.
Yeah.
And we're good. All right.
Yeah.
Your PAP is normal. See you next year.
Right.
Oh, my God.
And then you yourself started going through menopause.
Yeah. So I was polycystic. I had an endocrine condition I didn't ovulate regularly. Why I had fertility treatments for my kids and
You had PCOS?
PCOS. So I had, had the 2 kids. Finally got that done. I don't want to go through another miscarriage. We're done.
Yeah.
And so I go on birth control pills to manage my condition, which I did great on. That was fine for me. And then I get to about 48, and I'm like, okay, I think we're getting close to where we're going to be. And I'm totally suppressing my period, so I'm not taking the inactive pills. So I'm totally just replaced all my hormones and shut it down, you know?
Right.
Which is, I felt better that way than PCOS. So I was like, probably time to get off and see where we're at. Okay, so I talked to my nurse practitioner who took care of me, and then the next hallway, I was like, hey, I'm going to get off the pill, and we're going to get some blood work in a month and see where I'm at. She's like, cool, Very same time, my brother dies, goes into, so I have 6 brothers from the same parents. And my oldest brother died when I was 9 from leukemia. So I was a kid when that happened. And then my next brother, Bob, had HIV and hepatitis. And, the HIV is actually really under control really well, but it was his liver just tanking. So we get a call that he's, so I've stopped the pill, see where Mary Claire's at. And I'm in the OR and I get a call that the phone's ringing. I'm like, get the phone. And they put it to my ear while, and they're like, hey, Bob's in a coma. You probably should start heading home. And I was like, whoa,
Did you know that was coming?
Eventually, I'd sat the kids down and said, Uncle Bob's getting sicker, but not today.
It kind of was abrupt despite knowing it was coming.
Yeah. I thought we had a year or 2 years, So anyway, my partner comes down. We get to a good part in the case, scrubs me out, and I go and prepare to go home and figure all this out. So here I am grieving this horrible thing. And I am in full on menopause, but I don't know it. Okay. So I'm gaslighting myself. I'm attributing all the things to grief. And certainly grief was a part of it.
Sure.
But, after month 6, and I realize the grief is lifting. I'm not crying all the time on the way home. I'm not, save up all my tears for my drive home. I'm like, when was your last period? Shit.
It must be so comforting to hear an OB be out to lunch on their own house.
Yes.
God damn it. Ooh, and I didn't like menopause. I was like, ew.
Right.
I was like Samantha on Sex and the City, not the menopause.
Yep.
And so I was like, Dora, I'm going to come get the blood work now. And so we did everything. And sure enough, I was fully menopausal.
And that's detectable because...
check your estrogen, check something called FSH.
Yeah.
One's high, one's low. That's it.
Right, okay.
So
So it's all in the blood work.
Yeah. So perimenopause, no, we don't have
Okay, that's
blood
what I
work
was going to
for
ask.
that. So yeah.
Because I think I'm in it.
I know, everyone your age does.
all-
We'll find
yeah.
out.
I looked up all the stats for Southeast Asia. I was like,
Oh, you did?
Yes, I did.
Thank you.
Yeah, so we'll go over that. But I, reluctantly go on hormone therapy because I'm like, I cannot live like this. I was still in the impression that I would die. I would get breast cancer and die. It was going to kill me.
Well, let's address that right now because I happen to know way more about this than I should because I love
Women.
Well, I do love women, but Dr. Attia, I love Peter Attia, and he's been such a vocal supporter of this. But so all of this, the hysteria that you probably received was based on the work of two people virtually.
So the WHI study was a large multi-center trial. It was one of the biggest projects the NIH had ever taken on. And for the first time, they were studying women. We were so fucking happy. Like, wow.
Yeah.
We knew from anecdotal evidence that women who were on HRT and before the WHI.
And that's hormone replacement therapy.
Hormone replacement therapy. 40% of women were utilizing HRT in menopause. Okay. So that was kind of the baseline rate. It was recommended by the American College of Physicians. I mean, it was like everybody should consider this.
Semi-standard,
Yeah. So we knew that women who chose it had lower heart disease, had lower certain risks, but that's not proof. That's an observational study.
Yeah,
so
correlation.
If you follow Attia, you need a randomized, controlled, blinded. So NIH, $billion study.
$1 billion?
Billion.
Wow.
Let's study women. They got 37,000 women recruited.
Yeah.
Half were placebo versus estrogen or estrogen and progesterone if they had a uterus.
Which is a huge issue already right there if you're not combining the two.
Particular estrogen that they were on was Premarin, which we don't use today very often, and then a very specific progesterone. So it was a very, it wasn't using modern HRT formulations. It was just looking at this one. But at the time, in the 2000s, that was the most common formulations used. Nothing weird there. Because they were looking for heart disease as the outcome, is this really protective for heart disease, or are just wealthier, healthier women on HRT and we're getting an artifact? The average age was 63 in the study.
It's a little late for this study.
A little late for, we know it works for hot flashes. We know it'll take care of menopause symptoms, but, that's proven. But does it really help with heart disease? So they wanted to start later because it's expensive to go 20 years to see, so if we start later, then we'll start seeing the heart attacks, in a quicker time frame. So, but they did have younger, and they had some women in their 70s, start. They went up to 79. Wow. So off they go with the trial. The women on estrogen only had a 30% decreased risk of breast cancer. And that was statistically significant. The women on the combo saw a slight increased risk, but it never reached statistical significance.
It's really quick. The reason it was kind of irrelevant statistically is that the control group had an abnormally low rate.
That's it.
Which was not even considered. They for whatever reason, that control group was a standard deviation below the amount of
so when you compared the two groups, you were like, wow, whoa, this is really causing. So it was 4 guys.
Slabowski, Aragaski.
I can't even pronounce their names.
They're rough names.
And they still stand by. It's crazy.
Just recently, they're back at it.
They're back at it.
Yeah.
So there were 17 centers involved in the study. There were multiple PIs, primary investigators. And these 2 or 3 guys wrote this paper and said, estrogen causes breast cancer, HRT causes breast cancer. And they called everybody in a room and said, take a look at it. You have 1 hour to make changes. They rejected all the changes, and then they went to press. They went to the press.
There's no peer review. Really.
They just said it, and it was like letting a genie out of a bottle.
Terribly flawed study that got every headline in the world.
Flawed interpretation and hysteria. It was, there was no viral for internet back then, but it was the #1 medical news story of 2002. It was on the cover of every magazine,
Every
Nancy
nightly news
Snyderman is on
program.
ABC saying, don't give anyone estrogen. I was a chief resident. I remember the day it came out, and we were like, what?
Yeah.
I was terrified to give people HRT. What I didn't know in the ensuing 20 years, being board certified, getting my recertification every year, reading every article they put in front of me, I was the straight A student, right? They never walked it back, to the OBGYNs. They never said, hey, and the guidelines have not been changed in American College of OBGYN since 2014, and they still say, only for severe symptoms, smallest amount for the shortest time possible.
Wow.
And at pre-study, it was at 40%, which you said.
And then last year in 2023, we just got this published in the Menopause Society, it was 4%.
4%.
Wow.
4% of women who are eligible are receiving FDA approved. Now, there's probably more with compounded, but it's hard to track that because they don't report. So maybe 7, but still.
There's a great bit of context around this. So you start having the symptoms. You decide you want to do some investigation in this. And in your investigation, you quickly find out, if you were to search, medical peer-reviewed articles and journal entries about pregnancy. There's 1.2,
almost 1.2 million.
1.2 million. And if you look at menopause at that same period, 94,000 articles written.
So 10 to 1. And when, if you're in my world, and you guys probably realize this, do you know how much brain power we're talking about? How much NIH funding, how much private funding, how many labs, how much, that's 10 to 1. And more women will go through menopause than bear children.
Exactly.
Yes, and the bearing children process will last them however long you want to say that window is.
The average of 2 kids,
a couple
9 months
years,
each. Yeah.
30 years? No.
Yeah.
Yeah, so pretty nuts. And maybe now's a fun time, because I actually want you to explain menopause, but I think now would be a fun time to just talk about men versus women here.
Yeah.
Because my father, at the same time that's being published about HRT for women, my dad is being advised to be on testosterone because his level's low and it improves his life. He goes off of antidepressant. It's fine.
So men have a slow decline from like 18 or 19 down till they die, but they still make a reasonable, for most, it's still detectable. It's still, now you might function at better at a higher level and no one's going to deny that to you. It would be as if your testicles shriveled up and died at the average age of 51 and your empty ball sack is flapping in the breeze for the next 30 years.
Right. And we're not going to do anything about that.
And good luck to you, dude.
Yeah, exactly.
And we're never horny again.
So here's a sleeping pill. Here's something to improve your libido, maybe.
Yeah.
Here's a palpitation medicine. Here's an antidepressant. So
it's just like get through the rest of your life.
They're talking about over-medicalizing menopause, like in the critics. And I'm like, bitch. I'm giving her 6 drugs, or I can wipe the whole thing out with just replacing her estrogen that's gone missing.
Right.
Sorry.
And it'll actually because
it's a woman.
increase her bone density. It'll actually have real results. As opposed to treating
works
symptoms.
Better. It is the longevity drug for females. Nothing's going to work better than that.
Wow.
Yeah. So, I mean, there's a lot in there.
Now, you can raw dog menopause. No one's making you go on it.
Yep. I just think you can't underestimate the layers of sexism that exist within the fact that it would take another 40 years or however many years before we would acknowledge, women are really suffering from this. And they have a bunch of symptoms from a bunch of different issues arising from this. And better to treat those than to get to the core of what's going on.
For decades, when you look at why menopause hormone therapy was developed, it was to treat a hot flash. And forever, the pathognomonic, the poster child symptom was hot flashes, or what we call medicine vasomotor symptoms. What was never taught to me ever, and I learned like 3 years ago, was we have estrogen receptors in every single organ system in this body. And what I also was taught is in perimenopause, it's a slow, gentle decline. That's all I learned, one sentence. To decline until full menopause when you lose function. It is a rocking roller coaster. And your worst symptoms tend to be the ones like the mental challenges, the brain fog, the cognitive disorders, the frozen shoulder. All of it is peri and late peri and early menopause.
That's when you're accelerating your loss of
bone and muscle.
And the eggs, right?
We were born with all of our eggs.
Yeah.
Okay, so
1 million though. That was a shocker to me.
So 1 to 2 million at birth.
1 to 2 million.
But isn't this a weird? It's like that thing where you're born with all your eggs, and what's the thing? And then so really, your grandma's eggs are your eggs.
Yeah. So like when your grandmother was pregnant with your mother, the egg that made you was inside of your mother, inside of your grandmother.
Yeah. So in some ways, women have always existed.
So there's all this like knowledge, wisdom, and trauma
that
they think that this imprinting that goes on through a traumatic pregnancy.
Okay, a million. Okay, a million.
So
to
1 to 2 million at birth.
Yeah.
We lose eggs 2 ways. One, and from the minute they form, we start losing it through atresia, which is like an aging process, and it's kind of survival of the fittest, right? Because not all eggs are good eggs that you want to fertilize. So we want to leave the healthy ones behind to catch the sperm, right? Then, so atresia's happening, boom, 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 and it accelerates like at 35. We see a big drop off. And then just from ovulating, we lose about 10,000 to get one to like pop off.
Every ovulation cycle.
Every ovulation.
Okay.
So you're,
Is that in your menstrual, like the discharge? Where are all those eggs? The ones that didn't get...
They just kind of dissolve.
They dissolve.
So, so when the egg that one egg pops out, the fallopian tube picks it up and it gets swept like a chimney,
Travels, right?
through the fallopian tube and it's fertilized or not in the fallopian tube. And then it goes into the uterine cavity. And sometimes they can pick it up, in the when they've done studies, but sometimes it just kind of dissolves.
Right.
Yeah.
Okay.
But it's tiny, tiny microscopic.
Yeah.
Yeah, but by the time I wrote it down, by the time you're
30, you're down to 10%.
Down to
So how old are
10%.
you now?
37.
Okay, so at 40, most women are down, and this is different for you, and I'm going to explain why.
Great.
Don't hate, don't shoot the messenger.
I know.
Most
She already
women
knew.
are down to 3%. So then this is for people who look like me. This is the average American white girl. Okay?
Yeah.
For someone who, are you Indian or Southeast Asian?
Yep.
Okay. Average age of menopause is 46.5. For me, it is 51. Okay. Perimenopause, so that's
hits keep on
average. The
coming.
window is 40 is still, 41 is still normal for an Indian descent. And then that goes up to, 5 year, for 51. So you have you start younger. And then perimenopause, back it up 7 to 10 years before that.
Am I in it?
Maybe.
Are you so? I bet you have a mix of emotions: validation and depression.
I don't want. Yeah, this one is not good to be validated. I don't. Oh God. Okay. Well, I don't. How would I know?
That's a great question.
Yeah.
Certainly, if your cycles were starting to become irregular when they were always irregular, and if you had hot flashes, if you had the kind of cliche symptoms, but those are usually late in the game in perimenopause.
Okay, I don't have that.
So the most common symptoms, actually, now that these online telemedicine companies have developed for menopause, and they are doing scoring systems on hundreds of thousands of women, because everybody goes to their website, Am I in Menopause? And we have like all these quizzes and things you can take. Fatigue, out of the ordinary. Like nothing has changed. Your diet hasn't changed, your stresses haven't changed, but fatigue, new onset mental health changes. So we have a 40% increase in depression and anxiety across the menopause transition with no real environmental changes. We have weight gain. So it's a steady state weight gain, but what's happening in the background with body composition is we have this acceleration of muscle mass loss and an acceleration of body fat gain, typically in the viscera. So the intra-abdominal fat. So my patients used to come in and grab their tummies in their little paper gowns and be like, what the fuck is this? And
Yeah.
Dr.
Explain this to me.
Mary Claire, I worked in a small town and we all went to church together and whatever. What is this? And, I knew her. I worked out with her. We ran together. I know this woman. I know what she eats.
Yeah.
And this is and that's when I was like, why are all my friends and now me gaining weight in weird places? Like none of us have gone off the deep end and we're not secretly eating bonbons at night.
Yeah. You're staying consistent and your body's rapidly changing.
So, and then, bone density is another key thing. So we're seeing acceleration of bone loss. And so I'm telling my patients, let's get early bone densities. Let's not wait till 65, especially if you're programmed to go through younger than what's expected,
Okay, can you get pregnant? All these
You
questions
absolutely can get pregnant.
during perimenopause.
It's just a little harder. Yeah. Because your supply and the quality of the egg goes down, which you knew.
I did
the older you are, the more your fertility.
She's frozen some eggs.
I have. I've done 2 rounds, but it wasn't great. So there's already been some telling of like, but it is still regular periods, but as you said, maybe that's the later end of it.
Yeah, towards the end of peri, meaning you're getting close to exhausting the whole deal.
Combativeness with coworkers.
Oh my God, that's
mental health
specific to who you're working with.
Brain fog. Suddenly you lose your words. We all do it from time to time, but this is like consistent. Get in the car and you're like, where am I going? You walk into a room, what was I doing here? Everybody does that from time to time, but yeah.
Okay, we should have done this at the beginning, but now I'm going to make you do it now. We're unique as an animal. As a mammal?
There's a couple, there's a pod of certain whales that do it. And, elephants are very matriarchal. But when you look at like the anthropologists and they're like, why do women go through menopause?
Right.
So from a survival standpoint, it behooves a woman to not keep being pregnant over and over again. You kind of have your batch of children.
Yeah.
And then you have better survival rates if you stop.
Yeah.
And the anthropologists also think that women served as the source of wisdom for the tribe. Yeah. They were the passers on of knowledge. The dudes tended to die younger because they were getting killed by saber-toothed tigers and woolly mammoths and all the things. But the grandma stayed back. Now remember, these two people were still very young compared to us when we think of a grandmother now. Yeah. But like they kind of ran out of shelf life. We also died a lot sooner. Things that don't take people out now, like vaccines and, childhood diseases. And, we have a reason why we live longer.
You're right.
Stay tuned for more Armchair Expert, if you dare.
So right, and there was a very predictable role for the abuela, for the grandma, right? So she was passing on all this wisdom, helping with children. Now we have all these things. We have childcare, and we farm things out to strangers, and this whole role that once served our genetic fitness,
right? We've industrialized our way out of it.
Yeah.
We've evolved past our genetics, you know?
Yes.
Wait, so we're saying the reason that human women didn't die is because of their...
Well, those who kind of ran the gauntlet of disease and, you know, being killed by accidents and whatever, if they survived, they took on these, you know, the anthropologists... They seem to take on these very wisdom-creating, teaching the next generation. You know, if you look at whales, you know, they're teaching the babies to hunt.
Yep.
You know, while the moms are hunting, gathering with the dads.
Or grandma elephants, they're very involved.
They're very
in the
involved.
ant system and all these, And I guess, too, would I be wrong to say this? I'm assuming childbirth gets more dangerous as you're older.
Yeah. So it's harder to do and it's harder to stay healthy doing it. So we lose more women, you know, without... You know, in general, we would lose more women to cardiovascular issues, heart hypertension, preeclampsia, that kind of stuff. You know, before modern medicine, we had medications to help manage those conditions, diabetes.
So that's how we got there. We're kind of unique. There are, again, as you say, there are a couple of other people. But let's talk about what physically happens during menopause. Let's talk about the endocrine system. What is it? What does it do? And how does it change?
So let's talk about what you're going through right now, right? So in a healthy woman who has a regular menstrual cycle, nothing is ever steady state. You know, it's an EKG-like ebb and flow of some key hormones. And ovulation starts in the brain, not in the ovary. So in order to ovulate, the brain registers that our estrogen level is low. Okay, low towards, so you have your period, estrogen, progesterone drop off. The brain gets that signal. Whoa, we're low. It's testing. The hypothalamus is testing. It says, all right, it's time. Sends a signal to the pituitary, next gland underneath. And pituitary is like, all right, boss, I got it. The pituitary then sends LH and FSH. So if you've done any fertility treatments or, you know these words or had the shots, you know, I did all that too. And so those two hormones go down and bind to the ovaries to stimulate the ovulation. So around each egg are a set of cells, follicular and granulosa cells, and then produce our sex hormones. Estrogen in the first half of the cycle, which peaks at ovulation. After ovulation, we see progesterone rise. And that cycle is unbelievable and goes month after month after month in perfection, unless you're ill or you're pregnant.
Crazy athlete.
Yeah, you know, there are things that we can do to mess it up. But for the average woman, the cave woman, this worked very well month after month after month.
And is testosterone going up in preparation?
Steady state. That's one steady state that we have. It might mildly fluctuate, but really testosterone starts high, like in our 20s and 30s, and then just like a man's, just kind of starts.
It seems it would be evolutionarily advantageous if it upped your testosterone when you were fertile.
When you're
sex.
ovulating, but we just don't really see that. Female male drives are a little bit different. So then what happens in perimenopause, so in the background, we're losing eggs. We reach a critical egg threshold level, which is different for every human, where the signals coming from the brain no longer work. We become resistant because the quality and the quantity of the eggs available, you know, the cells around the eggs available are declining. So the brain's like, where is my estrogen? The pituitary is like, boss, I sent the signal. He's like, send more. So you get these bigger pounding. You start pounding the ovary with the GnRH to the pituitary. Pituitary is like, fuck, all right. Shoots out FSH and LH. We see these two, you know, the stimulating hormones start to rise much higher than they ever were in a premenopausal
woman. It's trying to kickstart this system.
And just kick it in the ass. So we see delayed ovulation. So the period starts to become irregular. And the ovulation is delayed a little bit. And then because you were just pounding that egg, we end up with higher estradiol levels than we ever had before. That's why twins are a little bit more common towards the end of your fertility.
Oh, interesting.
You know, than they were when you were younger, because you're just, you know, you're getting your self-made fertility drugs, basically.
Right.
To push that egg out. And then progesterone never quite gets to where it was before. So it used to look like this gorgeous EKG each month, now is literally a zone of chaos.
Interesting.
So you have estrogen doing this, progesterone's like, I'm trying to keep up. FSH and LH are all over the place. And that's why we don't have a great blood test For perimenopause, I can't do a one-time blood test and say, obviously. Now, for post, then when you run out of eggs, FSH and LH, the brain is always looking, always pushing, always trying.
Oh, wow.
And now we know we have FSH receptors in other areas of our body. We think the bone, we know the liver. So sometimes it's not just the loss of estrogen, but it's these high FSH levels that are leading to the cholesterol changes that we see. So
interesting.
A new study just came out 2 weeks ago that was looking at using a specific cholesterol marker, LDL marker, called super dense LDL, as a marker for perimenopause. Like, we don't have a good blood test, but like, would AMH be helpful, which is one of the fertility things that we check, which is a ovarian reserve hormone.
Would you have needed a baseline test prior to any of this for it to be relevant?
That's a great question. Again, I have people ask me all the time, like, okay, so if I'm going to replace my hormones in my menopausal journey, would it have been good for me to know in my 30s where they were? I'm like, where in the month would you like me to check?
Yeah, exactly.
The time I feel best
low
is what
level,
I'd say.
the high level, probably not the high, because that's when we have the breast tenderness and all the, that's, we worry about stimulating the uterine lining too much, you know? So, one of the problems with menopause treatment is we've just titrated to get rid of hot flashes.
Yeah.
But now we know women absorb very differently, and not everyone's therapeutic on our transdermal doses. So in my clinic, we're starting to check like 3 months out. What are her levels? How is she absorbing? And what we don't know is, like, we know that women who start HRT in the first 10 years have a 50% per year lower risk of new heart attack, cardiovascular disease, atherosclerosis. It's very protective of the endothelium. What we don't know is, what were those levels? We just know she was on it or she wasn't.
Right.
Yeah.
Right.
So should we be taking estrogen during perimenopause?
I think so.
Yeah, there's quite a big
We can
group of data
decrease
for
your
that,
risk,
right?
but it's just how. Do we suppress and replace, like what's in a birth control pill, like levels? Or do we just support, give you just enough to calm the brain down and make your symptoms better, but allow the process to proceed in the background?
Right.
There's tons of debate in my world about what's better.
Interesting.
Okay, so there are 6,000 women reach menopause every single day in the United States. And there are only 2,300 providers certified in menopause medicine. So once this occurs to you and you're going through it and you start getting serious about your own reluctance to go through this, which is a great motivator, how do you approach it? What do you start looking at? How do you even begin assembling what becomes the toolkit?
Yeah, so I wish that I could tell you, you could confidently walk into your OBGYN, your family medicine, your internal medicine doctor, and have a reasonable, logical conversation about your plan of care in perimenopause and menopause.
Yeah.
That is not possible right now. It is not the fault of the individual doctor. They may have been excellent in your birth and your pregnancy plan, in every aspect. But because of the 6 hours, so right now they surveyed residents coming out like 3 years ago. Only 30% felt barely adequately trained to treat menopause. It's awful. So at least they're honest. So, call ahead, look on the Menopause Society website, which is menopause.org, and see who has passed the test and is certified there. It's not perfect. Not every, there's always people out there who aren't great doctors, but who took the test. Yeah. But it's somewhere to start. We crowdsourced with my followers, and I've got thousands of testimonials, and we organize them by country, city, and state to help people find, they don't pay me, to go find a provider who might be able to help you. And right now, it's pretty slick. There's some great telemedicine companies that have been developed, mostly female-founded, who saw a gap in care and they saw a need, and they developed these telemedicine companies to serve the menopausal women.
So you don't have to live in Los Angeles or wherever.
I have women calling me from New York, LA, London, the most well-connected, you would think.
Exactly.
Who have the same basic questions and the same worries and the same fears and cannot find help as the woman sitting on the couch in Iowa.
Yeah.
Okay, so as you start focusing on it and kind of pledging to get competent in it and start treating women.
Yeah.
Are you yourself even shocked with the amount of symptoms? Because I wrote down symptoms, and it's about the longest list of symptoms I've ever written.
I was shocked, and most of that was driven by questions I got on social. As my little social media platform was exploding, women are, when 10,000 women ask you about frozen shoulder or palpitations or vertigo, you're like, they can't all be lying. You know?
Right. Anecdotally, you're just starting to see these huge
and I'm
patterns
like,
emerge.
let me look into this.
Yeah.
And so then I'm like digging and I'm like, there's somebody who did the study. There's data. We've got clear data here. So I go online and I make a little video talking about the correlation between menopause and vertigo, menopause and frozen shoulder, menopause and palpitations, and the world goes crazy.
Wow.
I get 10,000 comments. Oh my God. Why didn't my doctor know? Again, we're doing a terrible job of teaching, but I was literally learning alongside my followers.
Right.
As I learned, I'd make a video and teach. And that's what inspired me to write the book. And they were like, please write a book. I don't want to chase you all over social media.
Right,
it's too complicated.
Yeah.
Just put it all in one place.
Frozen shoulder is scaring me. Like my mom had it, my grandmother had it.
One of my mother-in-laws has been dealing with it for the last 6 months.
So this is a great story. And I hope I get the lore right. So if I don't exactly, but the story goes, the first study on frozen shoulder and menopause, I know it came out of Duke University. I read the paper. And it was the head of OBGYN and the head of orthopedics who both happened to be women. And it was something like they were sitting in the doctor's lounge or in the cafeteria and just shooting the breeze over, can you believe all these women with frozen shoulder? Da, 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 da. Yeah. You think there's a correlation? I don't know. Let's look into it.
Yeah.
They started pulling charts and they were like, fuck me. Look at this.
Yeah.
Women who are on HRT have a lower incidence of frozen shoulder and they do better.
Yeah.
They have it,
if they get it.
they're getting it, but they're getting it less than women who aren't, and they're having a better course, right? So they go to get it published, and then they go to orthopedic journals first. Nobody would touch it. Nope, this can't be right. Nope, this is an artifact. Nope. So one of the menopause journals published it. And so then I have a friend, Vonda Wright. If you follow her, she's an orthopedic surgeon. She does a ton of teaching, and she wrote the paper on the musculoskeletal syndrome of menopause.
How's that all work? What's the mechanisms there?
Estrogen receptors and probably progesterone here as well are all over the musculoskeletal system. We know bones. We got bones down, right? We've known about osteoporosis since I was a resident. I know that one really well. But what wasn't understood was tendons, muscles, and where the connections between bones and muscles and how that all works together. And frozen shoulder is adhesive capsulitis. There's a capsule around the ball joint and the shoulder that gets absolutely adhesed and frozen, and it's an inflammatory condition. And so you can't put your arm behind,
It,
you go to
seizes.
take a picture. Yeah. And it's very, very painful. And you need early intervention, you need physical therapy, there's needling, they have to break it up, right?
Yeah.
And that we can delay the onset and the duration and probably prevent several cases for women on HRT.
And as you said, because there are estrogen receptors.
Is protective, so it's an anti-inflammatory.
But my mom didn't even know that this was I've never heard her once say she had that because of menopause.
Well, no, most women don't know. Most orthopedic surgeons don't know. We're working to change that. All of this that paper was written a year and a half ago.
Oh, wow.
Okay, so ringing in the ears?
Yeah. So tinnitus, I still don't know how to say it correctly.
I had it for a minute and I didn't know what to tell people.
I've had it once and man,
people kill themselves from it. It's a maddening. Yeah.
So again, this is an estrogen receptor problem. So there's, and the vertigo is that the crystals break off quicker from is basically osteoporosis in the ear.
Oh, wow.
And the crystals break off and then float around and you're dizzy. But the tinnitus, it's the inflammation around the nerve and around some of the auricular bones that they feel like is leading to it. And that women all these studies say age-matched women, premenopausal women definitely have it less than post, and women on HRT are less likely to get it.
Yeah, wow.
What are some other
Dry
symptoms?
skin.
Yeah.
Dry skin.
So in the skin and tegumentary, skin and the hair
I like
follicles.
tegumentary. I've never heard that word.
That's
That's
a
nice.
fancy
Tegumentary.
skin.
Yeah.
So and all the follicles and oil and sweat glands. It's the whole system, right?
Right.
So
The largest organ in the body.
it is most absorbent. So we see we lose 30% of our collagen. You don't have to tell a woman that, she knows. In the first 5 years of menopause, we can attenuate that with topical or systemic hormone therapy. Topical works better actually, which is why I'm on my vanity cream.
Is it a retinol?
No, it's estrogen for the face.
Wow.
So it's compounded, but some people take the vaginal product and will mix it in their moisturizer and put some on their face. But you should talk to a doctor before you do. You shouldn't do that.
Right.
Don't do any compounding at home.
So mix it up, get a little mortar and pestle. So you lose oil production in the skin, you lose thinness, and the transepidermal water loss is much greater. So you're just losing all of your barrier, your protection. So the skin is less healthy.
Right.
Besides
it's just
looking
dehydrating
worse.
at a crazy rate.
Yeah.
Dry mouth, that's the same.
Dry mouth, same thing. So mucus production, the salivary glands dry up, and we have tremendous dry mouth. And dry eyes, dry mouth, it's the same kind of,
Guys, I don't want menopause. This is
decrease
fucking miserable.
production.
Body odor, what's creating body odor?
So early in menopause, as the estrogen levels decline, something that's made in the liver called steroid hormone binding globulin, SHBG, which binds our sex hormones and carries them around the blood and renders them inactive until they let loose, and then they bind to go do things. When we lose the binding hormone, the activity of our androgens increases, even though your overall level's not, your total testosterone may not be different, but the free is higher.
Yeah, so when I first got a panel for testosterone, my overall numbers were like fine, not alarming.
Yeah.
My free was super low.
Yeah.
And I had a really
Your
high.
SHBG was high.
I had the binding globulin.
Yeah, so you had some, but they were bound, and you couldn't use
That's right.
them. Yeah.
So there's it's such an equation that results in what you need.
It's a balance because, you can eat certain things, take certain things, certain supplements to increase, decrease, but then sometimes you're robbing Peter to pay Paul. And,
Right.
And so in women, when the activity of their androgens increases, we see male pattern baldness, they start getting chin hair, and their odor changes. They smell like onions, and, it's a really kind of weird. Yeah, I hear the onion thing a lot.
So awful.
Monica, I am living my best life. You just stick with me.
Okay, so I like to hear that because my mom actually said the same thing. I brought it up to her sort of. She didn't do, that I know of. I don't think she did any hormone therapy, but I was like, when did you hit menopause? She said 50.
That's,
or 50-ish, I guess. And I was like, oh man, well, I'm nervous I'm in perimenopause after I read this book. And she was like, well, I like it.
I smell like onions.
My
mouth is dry, and I'm happy as a clam.
I don't want to scare people, but so many women just go blindly into the night, and they have no idea.
Yeah.
And so, one of my critics have said, "You're just fear mongering. You want to scare people, whatever." I'm like, no, I want to educate, so you're not blindsided. Imagine the cortisol levels that will come down, where they're like, oh.
This is what's going on.
This might be my menopause. Fine, whatever. Okay, we got this. I'm not going crazy, especially the cognitive changes in the mental health. I mean, it is.
People,
The divorce rates, the suicide rates are all like right in there at this age.
They kind of peak there?
Peak suicide rates are 45 to 55 in women.
Wow, and that should be the kind of transition in life where you're like, oh,
kids
I
are out
made
the
it.
house,
Exactly.
I've made it. I'm going to lean into work. We're going to go off in the sunset here. No.
Wow.
That's heartbreaking.
And that's hormonal too?
The neurotransmitters in the brain are heavily influenced by estrogen, progesterone levels, and the brain doesn't like the chaos. So the real mental health that we see, the big problems are in peri. Post things tend to calm down, both cognitively and mental health. I mean, you still may need your whatever, but like we see this wild uptick in peri.
So decreased sex drive.
Yeah.
I think this is also something that people have just taken for granted.
I learned this much about sex drive.
She's holding up a 0 for the listener.
Holding up a 0, sorry. I get my little diploma and I graduate and I'm at the top of my class and I win lots of awards and off we go. I'm going to go be the best OB-GYN. And outside of pregnancy, so the pregnant people come and then these other people come. I'm like, ew. And so like as you're walking out from the well woman exam, I'm like, okay, we'll see you next year. She's like, can I ask you one more thing?
Yeah.
Sure. I'm struggling, I have low libido. I don't want to have sex. I'm really It's really affecting my marriage. And I was just like deer in the headlights. Like, what?
You're like, I don't know. So
I'm like,
you're
okay,
old. It's probably what you're thinking.
hold,
like,
please. So I go out in the hallway and I find my boss, who's like, our mentors when we first get out, keep us out of trouble in those first couple of years. I'm like, hey, so Miss Smith, everything's fine. She's healthy, pops and blah, 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 but sex, I can't even say it. I'm deep south and taboo. And he's like, oh, tell her to have some wine. She just needs to relax. And it'll be fine. Just pat her on the knee, but she's going to be okay.
Tell her to anesthetize herself so she can get through it.
Exactly.
This is women just go through this at this age. So many people were complaining over and over again. I started looking for resources. And I read Venus and Mars in the bedroom. Like that was my Bible. That was the only thing I knew how to do. No one taught me. I was going back in my textbooks. Nothing was talking about sexual desire, drive. Like I didn't even know all the causes of female sexual dysfunction. It was never a lecture. No one ever talked about it.
Yeah.
You know, and here I am like the expert going, I'll be right back.
Yeah.
Let me see what I can find. So I ended up making little handouts for my patients on what I could like dig up on desire and, you know, herbs and whatever. I didn't know about, well, they came out later, but Addie and Vyleesi and testosterone and all these things that might be helpful to a woman and counseling and therapy and looking for orgasmic disorders and arousal disorders and pain disorders and pelvic floor dysfunction.
Because it's common for sex to get more painful, right?
So when we go through the menopause transition, 100% of us are going to lose the protective effect of estrogen in the vagina, the vulva, the bladder, that whole what we now call the genital urinary system. So like pubic bone all the way back and up to the bladder. And we lose elasticity. We lose the ability to produce mucus. We lose the
That's thickness. The lubrication.
Yeah. So if you biopsied a pre- and postmenopausal vagina, premenopausal, it's this thick, velvety, full of mucus glands, very resilient. You know, it'll take a beating and be fine. You know,
baby. I mean,
baby comes through there. I mean, it's traumatic, but they'll make it. And then postmenopausal looks like a desert. You went from this gorgeous, thick, multi-layered tissue to 6 cells laying on top of each other with no mucus, no nothing, like a desert.
Yeah.
All we have to do for those women is give them back estrogen in the vagina. And all that tissue will grow back, even at 70.
Oh, wow. Really? So
and they will regain. You can absolutely prevent and reverse this condition. So I recommend lubricants for all of my patients on every sexual encounter. Like, just get used to it, do it proactively, make it a normal part, like normalize this.
Yes.
And then I'm advising not to wait until you start having symptoms to use vaginal estrogen. It's very safe. It's like skincare. You know, it doesn't absorb much. There's very much risk-free. If you have active breast cancer, you can still use it. It will save your life. I mean, it prevents UTIs. The best treatment for recurrent UTIs for a menopausal person is vaginal estrogen, not recurrent antibiotics.
It's topical.
Yeah.
Oh,
it's a cream.
Goodness.
Well, they have creams, gels, they have a suppository, they have a ring. There's multiple ways, but generic and cheap, the cream works for most people.
Yeah.
Wow.
Where's testosterone in the drive part?
So when we look at female sexual function, we have 5 buckets, right? Where she may not be happy. First of all, it has to bother her. Some women are like, I don't care.
Right.
I don't care and I don't care and I don't care and I'm never going to care. And I'm like, okay.
Then you're good.
You.
Yeah.
Okay. Other women are like, I used to have it. I miss it.
Yeah.
Let's talk. So you have to make sure she's not having pain. There's a pain disorder. She's not having a relationship disorder because no amount of testosterone is going to fix a bad relationship. Can she have an orgasm? Is the plumbing still working? You know, if she puts her mind to it, okay.
Does that drop off?
You see arousal disorders, it's more of a blood flow issue. I kind of had that. I was having delayed orgasm, like, hello, everything's working, I'm ready. And it's not, and so
let's get with it.
I was like, okay, fine, I need vaginal estrogen now. You know, and it took about 8 years in menopause because I was on systemic, but I wasn't quite getting enough and everything's fixed. Libido, which is desire. In medical, we say hypoactive sexual desire disorder, HSDD. That is a mood. It's totally in the brain. Everything's working down here, but it's the thought of it. And most women will come to say, once we get going, I'm fine. So if a female has an arousal disorder, vaginal Viagra might work for her because it's going to increases blood flow.
Okay. It's it's a vasodilator.
Vasodilator.
Okay. Specific
to the corpus spongiosum. So that's the like squishy part that gets erect.
Yeah.
And, we have exactly the same tissue in the clitoris.
Well, your clitoris becomes my penis in...
Same, the anatomy, so, except ours looks like Gumby and yours is like a little rocket. So we've ruled out all the things and she's like, I love him. I'm not going anywhere.
I miss it.
Please help me. So we have kind of 2 classes of meds that we talk about.
Okay.
One is testosterone. It works great for these women. You know, if it doesn't help her in 3 months, that's not the answer.
And the options for testosterone are
we don't have an FDA-approved option for women. So we're either having someone cook it up in a lab and a compounded cream generally.
So right there, red flag. Ridiculous, right?
Ridiculous.
This is
we have studies that prove the safety and efficacy and all the things. And she's so much happier. Yeah. And, there is anecdotal evidence that also her stamina is better, her mood is better.
Muscle mass goes up.
Muscle mass,
and then decreases osteoporosis. doses. Yeah.
So all that works together. So I don't want to say it's a chandelier. So I have low muscle mass genetically, and I'm doing the things, eating the protein, working out as a full-time job, wearing my weighted vest. And I was like, what if I tried some testosterone off-label for myself?
Yeah.
Did not have a libido issue. Okay. And no one was complaining. Everyone was fine at my house.
Yeah.
Right. When we did it, it was fine. And then start some testosterone, and I see an uptick in the area. He's a little more interested.
Yeah.
He's not cuter. He's not pissing me off less.
That's right.
Yeah.
He's not my
cute,
poor husband. But I'm just like, okay, a little more often, or maybe I'm even initiating, which had not happened in a long time. And we've just reached a different level now of that. And I think I would miss it if it was gone.
Of course.
So I'm like telling my patients this, like, certainly if you're distressed, let's go for it. But here's my experience, and I'm growing some little muscles here.
Yeah.
So that's a topical that's not approved.
You don't want to do oral. There's no form available in the U.S. that will not affect the liver. There's one in the that they use in Australia, Unducanoate, but it's not available here.
Got it.
So you're going to look at a non-oral option. So some people are doing injectables, like some compounded injectables. What we're doing in our clinic is either T-stem gel or androgel. So we're doing the FDA-approved gels for men. We're just using them off-label for women.
Interesting.
You can also get a capsule that
So
dissolves?
there's troches. So
That's
that
what they're called,
dissolve, that are submucosal. So you put them under your tongue and they dissolve.
Oh, I didn't know about
you
that.
mean the pellets. So
pellet,
yeah. So pellets are commercially available. They're not FDA approved. And there's a problem with pellets that we see kind of in the ethical realm. The two problems with pellets. If you go to a doctor and they are trying to talk you into pellets and they won't discuss any other form of hormone therapy, that is an ethical red flag because they are financially benefiting from the sale of the pellet.
Got you.
And I just think you can do better because pellets are very hard to manage. You have this rapid rise, and I've seen patients with females with testosterone levels in the 400s and 500s, and I am not kidding.
Okay.
They never made a female level pellet. They just give females the low level and say, you're running 200, you're fine. You're not going to die.
They don't slowly dissolve at a predictable rate.
They're supposed to. I've never seen a decay curve. Have you? They don't publish them.
Right.
They're not
Ooh, decay
FDA approved,
curve.
so they don't have the same regulation.
Okay.
So I'm like, listen, we don't need to be doing this.
Yeah.
right.
And I can take it away tomorrow. If you have a pellet, you are stuck until
3
it's
months
gone.
generally? Or?
Generally. So I think we can do better for our patients. I don't need to make money putting pellets in people.
Yeah.
It's a cash cow for a lot of practices.
Yeah.
And I'm just really hesitant. If your doctor is really railroading you into, if they say, I only do pellets, I would probably bounce.
Interesting. Okay.
Yeah, good tip. Okay, so back to, so we can do an injectable.
Injectable. You
a
can do a
topical.
cream.
Yeah,
So
cream.
it's like on your compounded cream. Yeah, you just rub it. So you pick
You'll
an
get
area.
really hairy wherever you rub it, but that's fine.
You could. So I'll tell patients to put it here.
Oh, I was
so the
teasing. Is that
androgel, there's no
real?
hair follicles here.
Oh, that was real? I was teasing.
I was studied on the shoulders.
Okay. Interesting.
So we want to monitor them to see how they're absorbing, make sure we're not going over, checking their free and total testosterone levels, and just seeing how they're doing.
I'll say I started on a cream. The only thing I didn't love about the cream is you have this dispensary for it, and you click.
Yeah, the clicky. Yeah.
But I'm here to tell you, the amount that comes out per click per day did not seem very consistent to me. It seemed a little all over the map.
Yeah.
I much prefer just an injection, you know exactly what you're getting.
So another option to think about would be to do the T-stem gel or the androgel.
How's that work?
So it's in a pump. So a full pump is 20 grams. And so for women, we need 5 to 10 grams. So that's like a half pump or a pea-sized amount. So, I tell my patients to put it here on their inner arm where there's no hair follicles so they can see the pea,
Yeah, yeah.
And then you just rub it in like this.
Do a little rub.
Wow.
Stay tuned for more Armchair Expert, if you dare.
Okay, so you're doing testosterone on your arm,
Yeah, it's so
estrogen
complicated.
on your vulva.
Yeah, we're doing.
What
I think I
else?
replaced my hormones like 5 ways. I have.
Yeah.
So for estrogen, there's oral and non-oral, and in non-oral, patches are what we usually prescribe in my clinic.
On your Instagram, you're a fan of those, right?
They're very inexpensive. We have multiple strengths, so I have a lot of options for patients. But sometimes people have a reaction to the adhesive, like tape allergies and stuff. So we have gels and creams. The expense goes up. The vaginal ring is great because you get a 2 for 1. You get systemic and vaginal. And these rings, but they're like $200-$300. They last for 3 months.
Oh, 3 months.
It's nice. You just throw it up there and forget about
Toss it in.
Yeah,
you know?
I get scared of that.
It's not for everyone. You have to like
even like the Diva cup and stuff, like it's not for me. It's not for me having
You don't want something in there.
Yeah, I don't.
Because you have you have an outsized fear of toxic shock syndrome.
I wouldn't say
that's bled over
outsized. I
to-
have a real fear of it.
Yeah, as you should.
Yeah,
It's scary
right.
as hell.
It's scary, and you die.
And then there's local estrogen options for the face or the vagina. And then your progesterone. So progesterone is typically given like in the menopause. We're giving oral micronized progesterone. It's the safest.
Can you tell me? I believe I understand a lot about testosterone and estrogen and estradiol, but I don't know that I know a ton about progesterone. What is it doing?
So progesterone is mandatory if you have a uterus, if you're doing estrogen, because the inside lining of the uterus, the endometrium, where the blood's would be made each month, is sensitive to estrogen. If we let estrogen play in there unopposed with progesterone, you'll develop hyperplasia and potentially malignancy.
This is where some of those studies were misleading because
that was in the early days of hormone therapy and the like get your wife back sexy movement with estrogen. They were doing just estrogen and women were getting endometrial cancer. So we learned that lesson. You give her a progestogen, you will negate that. Okay.
Right.
So if she has a uterus, without the Mirena IUD, which has progesterone in it, you must give progesterone to not give her cancer, right?
Right.
Potentially give her cancer. Turns out progesterone is amazing for sleep. It upregulates GABA in the brain, and it is our sleep hormone. So when patients are coming in early perimenopause, still having regular cycles, but they can't sleep, they're waking up at 2 or 3 in the morning, progesterone might be your new best friend. Okay. You can start, it's fine to start with progesterone without estrogen. We do that in a lot of cases.
I have so many things to take.
No,
I don't.
It's,
I do.
For the
I
nighttime
need
anxiety thoughts. It's great for that. It's great for that 2 a.m. wake up. Like I'll just take an extra one if I still have that.
I mainly have a hard time just falling asleep.
I mean, it's worth a trial. It's not going to hurt you. It's a natural hormone.
And none of this is a problem with getting pregnant.
Well, if you're in perimenopause, your chances of getting pregnant are lower.
Yeah.
But if you are trying to spontaneously get pregnant, you have to make sure you're giving low enough doses where you're not going to inhibit a standard ovulation. And menopause hormone therapy really does not, is not high enough to suppress ovulation. So the biggest difference between birth control, there's two.
That's what my
birth control pills and menopause hormone therapy. You think about why they were created. Birth control was formed for contraception. We need a high enough dose to shut the signal down from the hypothalamus, to tell the hypothalamus, we're cool, we got enough estrogen, no signals, no ovulation, okay? Menopause hormone therapy was developed to simply stop a hot flash. Mm-hmm. You don't need nearly as much.
Got it.
So it's lower.
Formulation, though, is different because of big pharma. Right. So formulation tends to be ethinyl estradiol, which is cheap and easy to make, but it's 100 times as potent as estradiol.
Right.
And that's why you have those little tiny birth control pills, right? Whereas estradiol in its natural form, which is body identical, is it's much less potent than its cousin ethinyl estradiol.
Got it.
But it's got a great safety profile, and you don't need much to stop the hot flash. Now, how much do we need to prevent cardiovascular disease? And you don't need much to help your bones. They did study those numbers. So we're all like kind of debating if we're going to check levels, what's therapeutic?
Okay, wow.
Okay, so we really covered HRT, hormone replacement therapy. I'm so glad you're an advocate for it. I think it's insane that women have been just left out of this. What I have experienced being on hormone therapy, which is like made me want to work again, made me want to do my hobbies again, made me mentally, and then my fitness and everything.
All the things,
right?
Yeah.
I remember Kristen going like, this is bullshit. I'm like, you're right. It is. This is insane.
How many doctors did you go to before they gave you testosterone?
They're dying. I have to police them.
A woman on average has to go to 6 to 8 doctors before her menopause is diagnosed. This is how bad the problem is.
Well, I'll be clear. The general practitioners tend to still be pretty adverse.
Okay.
Across the board in my experience, my anecdotal experience. But we have hormone clinics on every 10 feet for men that most of them don't see women. So all one needs to do is go there. And that's what you actually need to police them, I think, is my tip.
And that's kind of like some of those got like the pellet, it's the BioT really that got into, let's put these in women and see what happens,
Yeah. And you don't need to be at 1,100.
No. I mean, these women are coming in, they're like, I don't know why my hair is falling out of beard. And I check her level and it's 450. I'm like, I might have a clue.
Oh,
Yeah, because women, naturally in their 30s would hover around
So
what?
around 40 to 70.
Yeah, so that's a good 8X.
Yeah. So, most of them come in menopause 12, 15, 20, 25, So I'm like, let's get you up. So I'm trying to titrate my patients 60 to 70. Like, let's overshoot just a little bit, and see if this is going to help with your libido.
Yeah.
But there are 2 FDA-approved medications for libido that are not testosterone. One is Vyleesi, and it is an injection you give yourself 45 minutes before, and it causes a massive dump of melanocortin that then stimulates dopamine. And when our dopamine levels are higher, it makes us want to do things.
Yeah.
So
we want the
unfortunately,
unknown.
most of my patients don't choose that because they're like, there's a praying mantis on the other end of this waiting the 45 minutes going, is it working?
Well, additionally, it's like it's almost the wrong medicine for the arousal type that women are, which is like, that's great for a man because a man's sitting around thinking about wanting to fuck in an hour.
Yeah.
And he's like, oh, yeah, I'll do this. Whereas a woman needs to be brought into
It's
arousal.
not very romantic.
Exactly.
Yeah, so it's almost like a counterintuitive solution.
For the women who like it and can unlock that part of their brain, it's great.
Is it a base dopamine? Like, don't give it to an addict.
I don't know. I've not seen those studies. I mean, I've not had a patient yet who was like, yes, please. So Addie is another. So Addie was studied in mood and they saw an uptick in.
Tell us how Addie works because they're a sponsor.
Addie works, same thing. It's going to increase your dopamine levels. And it's something you take every day. Okay. It was studied in mood. It works by increasing, happy sexual encounters, a couple of more times a month or, however they measure it. So the detractors of Addie are like, well, that's not enough. And the women are okay with it.
Right.
Right.
If you were having none or 1, going to 4 is like,
That's enormous.
great.
Yeah.
So I'm like, let the patients decide.
Yeah, totally.
Most of my patients choose testosterone purely because of cost and potentially the other benefits for bone and muscle, even though we don't have great studies yet, but the anecdotal data is looking very positive in that area.
Yeah.
Right. So if you just kind of reverse engineer, as I understand, or if you believe Atia, and I do, the best way to combat osteoporosis
is to not get osteoporosis.
Yeah, that'd be great.
Is to not get it. But your bones respond immediately to muscle and strain. So if you can work out heavy, you're putting a lot of strain on your bones and they will react. They will make themselves stronger.
Yeah.
And for you to do a lot of strenuous and high intensity, heavy lifting, you're going to benefit from testosterone with your muscles. So it's like they're all related.
It all works. The musculoskeletal unit works together, but it's like it's not like it works in isolation. So testosterone will help a little bit. We looked at one of the things from WHI, when the Women's and Health Initiative, is they followed these women forever, and they followed them into nursing homes, and they looked at protein intake and frailty scores. And the women who ate the most protein, like 1.6 grams for every kilogram of lean body mass, had much lower frailty scores.
Yeah.
So I'm drilling down. We're going to prevent your osteoporosis. We're going to consider hormone therapy and estrogen. We know it will prevent 50% of fractures.
Yeah.
So if she's on HRT, we're going to work out heavy. We're going to lift heavy, and we're going to eat the protein. We're going to get some creatine on board. So all of that works synergistically. I call it my nursing home prevention program. Because once women, I put out the fire for menopause, and she's functional, and she's your mom and me.
Right.
Now we're like, I don't want to be my mom.
Yes, that's how
I don't want to end up. My mother is in a nursing home with Alzheimer's and a broken hip. She's in rehab. She just got out of rehab. But she's not doing well.
Right, exactly.
And it's going to take a long time.
And all of these 4 horsemen are metabolic disorders.
Alzheimer's is not the natural course of aging brain.
Yeah.
It's not.
That's a metabolic condition.
Yeah.
So there's ways to
there's 14
fortify
risk factors. So of course the easy stuff: don't smoke, eat a balanced diet, stay away from processed foods, don't get diabetes, don't get insulin resistance, don't get, all of that. But then it's social connection. Keep your brain moving, thinking, working, do the puzzles. Don't. When my dad died, Mama had lost Bob in 2015, one of my brothers, my second brother from esophageal cancer, the third one. They lost the one when he was 18, when I was 9. She'd lost 2 kids and a husband in 5 years. And she was like, I'm out.
Yeah.
She locked herself in the house and started drinking, which I can't blame her. But what I've seen it do to her, to the relationships with her kids, And this long protracted course she's going to have until she goes. And all the talking of the children on how to manage and who's doing what and da-da-da-da-da. I don't want that.
Exactly.
Right.
I
You know, I want to die like my dad. He was great until like the last month.
Yep.
And then he kind of slowed down. And then we all gathered around and we sang songs and told stories and we're there and sang to him and he slipped into a coma and then it was over.
Yeah, that sounds great.
Yeah, he
But
went out
that's not
looking
what
at the
happens to women. We have this like nursing home. She's frail and she breaks. And
Alzheimer's.
like no.
Yeah.
Boy, that's so true for my grandparents. It's like both of them, the men just collapsed.
Yeah.
And the women just struggled for 5 years
struggle
and got
bus, 5 to 10
crankier and
years.
more miserable. And
Yeah. So my patients are not interested in option B.
yeah. Okay, so we have diet, and I'm glad you're flagging
toolkit,
protein. Yeah.
So top nutrition tips, I think, for like aging and longevity for women in menopause. Is she, limiting added sugars? So the whole keto movement, sugars got demonized. But it turns out that sugars added to stuff are much worse than found naturally in fruits and vegetables because the sugar in a fruit is wrapped around in a fruit, which has fiber and vitamins and minerals. And, so and this is a doctor who sells supplements, but like, I think everyone should be able to get everything they need from food. That just doesn't happen. That would be amazing if it happened.
Yeah, that's ideal.
So I'm here to like help you fill in the gaps where you need it. Fiber, vitamin D. 80% of my patients are deficient in vitamin D.
Yep.
So we're checking everyone's levels. We're telling them to supplement. I'm giving prescription doses. If they're super low, we're trying to give them loading doses. Magnesium is really great for a lot of patients.
I've been taking magnesium.
I have a specific collagen product that was studied in menopausal osteoporosis that seems to have some benefit. So we're talking about that. For movement, most of my patients are walking minimum. And then so if you have to meet her where she is. If she's sedentary, just walking 30 minutes a day will decrease her risk of diabetes by 50%.
Yeah, wow.
That's it. If she's walking, let's put on a weighted vest. If she's doing that, let's get in the gym. You have to meet them where they are.
Yeah.
And so, all the influencers and whatever, they're like, oh, and they're lifting and all that. And I'm like, that scares the shit out of most women.
Yeah,
They
it
don't
seems
know.
insurmountable.
Yeah, so we're easing them into it, and I love to run these challenges for my followers. We'll get 100,000 people, who are lifting weights for the first time, and I'll have a little, a fitness person in there because I didn't know either. I was kept injuring myself.
Of all the ologies, you didn't do
That is not, kinesiology is not on my list. So I will hire someone to come in and show my followers how to do a squat safely.
Yeah.
And you don't have to do a lot. I mean, you don't have to do a lot of different exercises, just the really basic push, pull.
There's some real key ones that are super beneficial, particularly for osteoporosis.
Squats, lunges. For osteoporosis, good studies with the weighted vest. So just walking with a weighted vest. Doing yoga with a weighted vest, like balance training with a weighted vest is super helpful. Vibratory plates, again, you're stimulating that, musculoskeletal
So you
unit.
don't fall.
So you don't fall. I tell patients to brush their teeth on one foot because you're working on balance. Like to always be decreasing your risk of fall with balance training.
Yeah, falling's a huge
And then lifting,
health
they were
risk.
putting 80-year-old ladies in the gym from nursing homes, and they were seeing all these gains and improving
Hand
their bone
grip
density.
strength's a big indicator.
So
and
this
predictor.
is just a proxy. So grip strength is a proxy for the rest of your body.
Right.
Okay.
So, grip
If you do
strength is
deadlifts, you will inadvertently get greater.
greater. Yeah. So it's not the grip strength. It's that.
But it's
That's an easy thing
that's
to
an
measure.
indicator. I
It's
got
a
it.
great
That's an
indicator.
indicator.
I see it. Okay.
So that's exercise, diet. Now, where do GLP-1s fit into this?
So we do use them in our clinic, and
Yeah.
probably 20% of our patients end up on them. So, when they come to us, it's usually, hi, I'm in menopause, help me, I'm dying. Okay.
Yeah.
So, and probably 50 to 60% of them have a weight problem, have either always had it or they have new weight gain. So the first thing we do is break down where their fat is, if they have it. Because some patients come in, they're just muscular and they've been told they're obese their whole life and they're crying their eyes out because, oh my God, I'm healthy. What?
Yeah.
If they have a visceral fat problem, I really don't care about subcutaneous fat. It's not metabolically that active. It's just storage. It's the intra-abdominal fat that'll kill you. And so we are working on that number. And what do we know works for that? Well, starvation, but that's not why they're there.
Right.
High fiber diets, low added sugar, probiotic, diets rich in probiotics or a probiotic supplement, zone 2 training, all of that works. So we're focusing on that and we get her an HRT. Across the menopause transition, a woman will go from 8% of her total body fat being visceral to 23 on average, just from becoming menopausal. No changes in diet and exercise.
3x.
Yeah.
Wow.
So, and they know. You don't have to tell a woman. And so then I show it to her. They follow. I have unusual circumstance of most of these people follow me, have read the book. It's an investment to come and see me because I'm outside of the insurance model.
Yeah.
So they've done their homework.
They're dedicated.
Yeah. And so they're like, okay, let's do this. We start HRT. We bring them back in 3 months, okay? If her cardiometabolic risk factors are still there, and she's like, I want to give it a try. I'm like, let's go for it.
Right.
So a GLP-1 needs a lot of counseling to be done well.
Yeah, because you're taking on a lot of risk of muscle mass loss, which is so important for your
And they know that. Like, we spend an hour on the
Although
first...
there's supposed to be a new one coming out.
That's 3. So there's, semaglutide, which had just the GLP-1, and then tirzepatide, which is what we usually start with now.
Right.
Which has the GLP-1 and the glucagon agonist. And then this new one has I forget what the third ingredient is, but I'm excited to see when it comes out.
Yeah, it's supposed to reduce the loss of muscle mass.
In our clinic, if the patients eat the protein and do the resistance training, we are seeing some muscle loss expected, right?
Right.
But not this massive loss.
Yeah.
And they are able to maintain. And then it's like that first 3 months, they'll lose, maybe 5, if they lose 20 pounds, maybe 5 is muscle, maybe 20%.
Right.
And then they're like, okay, but then that just like levels out and it's all fat loss after that. It is absolutely the coolest thing to watch because we bring them back every 6 weeks to check their muscle mass. We stay on top of it. We're checking in with them because they know they don't, they're doing this not to look great in a bikini. I mean, maybe that'll happen and that'll be great, but they're doing this to decrease their risk of all these diseases they don't want to die from, or plague their children
the last 15 years of their life or 10 years of their life.
And be happy during those last periods.
And not, they're so motivated to avoid the diseases that plague their elders.
As you might expect, my wife, knowing that I was interviewing you, had some specific questions.
Fire away.
Are there any ways to predict when onset will be? Kristen heard your mother's sister can be a guide. Is that?
Your mother is, there is a genetic component. So there's an ethnic kind of genetic component. So I was telling Monica, for me, it's 51 is average. For her, it's 46.7.
That's
really,
4.5 years.
They're, African Americans is about 18 months behind Caucasian. Asians get a little bit longer. Okay.
Does sexual activity impact that?
Trauma does. So we know lots of things that speed it up, right?
Okay.
You were born with X amount of eggs and they're going to go before you die, right? If you live a normal lifespan. But what do we know speeds up the process of egg loss?
Yeah.
Smoking, for sure. Okay.
No problem
Chemotherapy, radiation, abdominal surgery. You have a hysterectomy, leave the ovaries behind, but we've cut a significant blood supply to the ovary. We're going to lose average of 4 years off the life of the ovary. A lot of women undergoing necessary hysterectomy aren't getting that counseling. Like, there's nothing they can do about it, but like, wouldn't that be nice to know?
Yeah, I have a friend's friend who had to have a hysterectomy. And then, she's like she's like, I'm about to be in menopause.
My mom had one when she was 30.
My mom had one after baby number 8. They were like, this is your Catholic birth control.
Right.
So time for that uterus to come out.
So does it instigate menopause?
It cuts the blood flow. So you lose the shelf life of the ovary where you may have gone through at 51. Now you back that up 4 years on average.
Okay. But it's not like you have the hysterectomy and then
unless they remove the ovaries. Right.
Exactly. Which
so that's
they didn't,
surgical menopause, and we have premature menopause and early menopause, and
Okay.
So those are a little bit different animals.
Interesting. Okay.
Premature ovarian insufficiency is usually due with an autoimmune condition, so it has its own set of risks. And then surgical menopause, you don't get a trial period. It's like boom.
Yeah.
So whenever I had to take out ovaries, for medical reasons, I was putting a patch on them in the OR.
Yeah, that makes sense. Yeah.
Okay, so the ethnic is a predictor,
so ethnic,
ethnicity.
and then family history. So you look at the women in your family, when did they go through it?
But on your mom's side, is she right about that?
Mom's side and sometimes dad's side. I mean, you're half genetically...
Yeah.
Well, so that's what she compared it to male pattern baldness, which we know comes from your mom. But I was saying, well, that's because it's on the 45th chromosome and you can only get an X from mom.
So this isn't a chromosomal thing.
So it's not
it's
like
more
that,
of a general health and kind of how things are going to go.
Okay.
All right.
Certain tribes, in Africa have a lot of twins, or certain, cultures are more prone to twins. That's more of a general, than a chromosome thing.
What do you think about this? There's a couple things happening. It was completely understudied, as you pointed out. It's beginning to get studied, but also we're seeing in art. Like, what do you think about the impact of all fours?
So I'm literally on 79% of the chapter. First of all, I hate the protagonist. Like,
Yeah.
so she's not my girl.
Yeah,
Okay.
she's
But
tough.
so I'm researching and writing the new perimenopause. Like, it's not coming out till 2026, but like I'm in the middle of it. And so Gretchen, who's my co-writer, and I write like an asshole. Like, I am so clinical. I am so and my collaborator will take my disgusting prose and spin it into something that sounds like
Digestible,
like
yeah.
a human,
Yeah.
and that a normal person could read, not geek. So, and Gretchen's like, read it from the perspective, this is resonating. And that
big
just
time.
flipped the switch for me. I read for entertainment. I read about fairies and dragons and lots of sex and my daughter reads all the dystopian novels. So I read with her and talk about stuff.
Yeah.
So that's kind of my jam, my genre. And then I read medical journal articles. So like to pick up a book that is outside of my usual, like a fiction, and like not have a 15-year-old like little girl who turns into a princess with magical powers was like hard.
Yeah.
You know?
Yeah.
And so I'm trying to identify this. And she says, stop trying to identify, read it and figure out why the hell the world is
huge.
resonating. So that kind of
Yeah.
made it. And then I'm like, oh. So then like the doctor in me is like, that's menopause.
Yeah.
She's having palpitations. That's a panic attack. That's menopause. That's menopause. That's menopause. Now, like have an affair with your husband and redo this room in this weird hotel. And I don't know, that's a whole nother thing.
Sure,
but
sure.
like, I'm getting it now. Like it is so hard resonating. They've already like movie rights are done.
Oh yeah.
Yeah.
Oh, we all like as soon as all my friends read
Did
it. we
you
were like,
love it?
I loved it. Yeah.
Okay.
But do you not see? I haven't read it.
Okay.
I've been told what it's about from Monica, who loved it. To me, it's like I was prescribed a role I don't want, or I want to test, or I want to shake up, or I want to break because I just prescribed it, and now I want to decide.
I don't want it anymore.
And that's so perfectly parallel to like, hey, guess what? I don't want to live a third of my life in discomfort.
So what I'm finding, and I think why the divorce rate's so high, is that women, and myself included, and thank God for my relationship, it's better than it's ever been. And we're working together. Like we have a small business through the supplement company and he's now running it. And I've never liked him more. But like, I'm like, yeah, she's getting to choose
Exactly.
the last third of her life. And so did I.
Yeah.
And I chose differently than her, and that's okay. But, but women are circling the wagons around themselves. Like menopause is fucking them so hard.
Yeah.
They are giving themselves permission to put themselves first.
Yes.
To me, it's I've had
exactly.
enough on all the levels.
And now it's like it's a survival thing. If I don't do this, for me, my journey was quit a job that didn't serve me, stop serving a system that was broken, absolutely get the hell out of Dodge, figure out what the fuck I wanted to do with my life.
Yeah, exactly.
And put my own oxygen mask on first.
It's time for you.
And I really didn't give a shit if the kids or my husband cared.
Yeah.
Yeah,
But I had to
exactly.
do this. Thank God it all worked out.
Yeah.
Yeah.
And look where I am now.
But that's what it is. It's like I'm making choices for the first time that aren't
That are
just
for me.
That are for me. That
Yeah.
aren't just like handed societally to you. But what's scary about that book is like, oh my God! But now is the time I get to make the choices, and I don't. And then my body is disintegrating, and I'm that's the part that I think everyone was like, oh my God, we have to wait till then, and it's coinciding with that. What do we do?
How do
What do
we
you do?
prevent ourselves from getting to the too late part,
Exactly.
right?
Too late to celebrate. Well, educate yourself as soon as possible.
Yeah.
And that's part of my mission is just vomiting all over social media.
And I think a lot of people won't know intuitively. I think a lot of people think of HRT as being what you do after you have all the symptoms.
Right.
And people really, that's the next wave, I think, is preventative. Yes.
And so where some of the hardcore old school menopause, people are like, don't say prevent, like come after me every time I talk. Look, FDA approved for the prevention of osteoporosis, and that is enough for me. But let me tell you, the U.S. Preventative Services Task Force needs to get their shit together because if you have a window of opportunity for
Yeah.
cardiovascular disease prevention and the data coming out clearly for mental health, we can prevent the suicides, the job loss, the brain fog, unless you're on the dementia spectrum,
Right.
with early and judicious hormone therapy, not allowing your body to withdraw and go through that
why
chaos.
wait till you have all the symptoms? Why?
Exactly.
Yeah,
Why
it's
wait till your
crazy.
vagina's broken?
But there's no other condition that we don't think early detection and treatment is beneficial. But this, for some
It's
reason,
never been thought of like that. It's like, wait till you're miserable.
Yeah.
And then it was like severe symptoms only. A doctor's going to tell me if my symptoms are
Exactly.
severe enough?
Exactly. What does that even mean?
What does that even mean?
And
Yeah.
why? It's like some old vestigial Protestant suffering. Something.
Look, women have been taught to minimalize their stuff. Like,
Yes.
I was taught. Did you read the WW story? I don't know if you.
Oh yeah, whiny women.
The whiny woman.
Yeah.
You know that. This is just what women go through. They tend to whine a lot at this
Say that
age.
early in her residency, they'd come to her and say, "We got a WW in room 305 or whatever."
And that was a woman with a laundry list of complaints, very vague: weight gain, brain fog, low libido. Yeah, and they're like, check her thyroid. Get these tests. Make sure you're not missing anything, but you're not going to be able to help her.
It's just a whiny woman.
It's just one of those whiny
so I've talked
women.
to other doctors across the country, and in California, they called it whiny gynies.
Oh, nice.
And on the East Coast, like around New York, it was TBD, total body dolor. And in Miami, it was Madame Dolores.
Oh,
Madame
my
Dolores.
God.
What is that?
Pain.
Oh,
Like
okay.
she's got a lot of pain.
Oh, okay.
So women who come in and complain a lot about kind of vague, and you're not going to
Fatigue. What is that? What do you mean?
Fatigue,
Yeah.
libido. Go have some wine. You'll be okay. honey.
Yeah.
The answer.
Oh my God.
Oh my God. This is wild.
I don't want to scare people, but like women
No, it's
should
good to know. We don't know anything.
And your doctor, not their fault, may not know anything.
None of us know. Even this smart people who are educated. I do these girls' dinners, and we just had one recently, and we were talking about something random. We were like, why don't we know the answers to any of these questions that keep popping up about our own bodies?
Yeah, because it was never studied. I mean, women in medicine have been studied as treated as small men, so excluded from studies till 94 because of thalidomide and what happened, so like, oh my God, if there's a chance in hell she might be pregnant.
Exactly.
We need to exclude her. And we probably shouldn't study them anyway because hormones are hard.
Yeah.
They didn't even study female rats in the lab. It was only men.
Really?
Because they have estrus.
They too.
So they too will
my
fuck up
God.
your
It'll be
study. And
confusing.
So like the cardiovascular data is awful for women.
Yeah.
You go into the ER with a heart attack. If you're a woman, you have a 50% higher chance of dying than if you're a man because we have atypical chest pain.
Exactly.
So men, and I was taught this, women tend to have atypical chest pain. Men have, the classic clutching their chest, going up their neck, sliding down their arm,
all those
that
signals.
whole if you're an actor and they're like, pretend you're having a heart attack. I know exactly what you're going to do.
That's right.
Right?
Yeah.
A woman has fatigue, abdominal pain. It's very vague, okay? Because men have the LAD, the widowmaker, the very large vessels that immediately come out of the aorta to dive into the heart muscle to feed that heart. That's where the plaques happen.
Mm-hmm.
Women, it's way down below that. It's the diffuse microvascular disease.
You're always shoving it down.
Another way to speed up your menopause is trauma. So there was a study that looked at women who were sexually abused who then had kids who went on to be sexually abused, and they went through menopause 9 years sooner
Wow.
than average.
My mom must have hit menopause at like 35 because she had a
Also, she had a
hysterectomy. She got the trauma, then the kids with trauma.
Her libido's okay.
That somehow is, well, I think it's trauma related, but yeah.
That's true. There's a million factors.
Your book's a bestseller, The New Menopause, which we have right in front of us. You have the Mary Claire Wellness Clinic.
Yeah, it's my little baby clinic in Galveston.
And that's in Galveston. You have many millions of followers that are interested in this subject.
You were the
It's a
person
real
people
moment.
wanted to
Yeah,
come
we
on
turned it
the
over
most.
to America and said, like, who's your favorite menopause
Really?
expert? And
Yeah.
you were
Thank you.
voted on. You were elected.
We were just like, who do you want to come on experts? And your name came up over and over and over
That's,
and over.
Yes.
it's a different audience.
Yes.
But is it, it's all women.
I don't know. Yeah,
Yeah,
we have
exactly.
a lot of women.
We have just people need to know. People don't know
Well, I
anything.
appreciate being on here. And actually, my kids now think I'm cool.
Oh, wonderful.
Yeah.
2 daughters?
2 daughters, 21 and 24.
Okay, cool. And Monica's.
Are they
I hope.
on? Are they like how early? Oh, that's a question. How early can someone get on these things?
Well, it's a little early for them. You
Okay.
know? So Catherine's in med school. So
nice.
she's tough, man. She has guaranteed me she's not doing OBGYN, but she is like, talk about having someone hold a mirror up to you and like keep you in line and double check your facts behind your back, you know?
Yep.
So I'm like spitting out studies and she is literally looking it up
That's
to make
good.
sure I am like toeing the line. But she's talked about it. Like she's a little freaked out and wants to like freeze her eggs now for the highest
I
quality.
think that's the move.
I kind of do
So,
too.
you know, and so there's, I did a talk, I was at Reese's event She did Hello Sunshine. And I was the MC for the first time. That was fun. Of a panel. And one of the panelists started like this where you go and you donate your eggs, but you get to keep some.
Oh.
So it's a way for the younger women with like these juicy, gorgeous eggs to afford.
Oh, it gets paid for by the
Right.
That's nice. I
She
love
gets
that.
to keep a few for herself.
Oh, I like it. Little for you, little for me.
I'm a terrible host because I forgot the name of the company, but
We'll find it in the fact check. We'll put
It
in
was
the fact
like
check.
so cool.
That's
and so I
awesome.
went home and told Catherine about it, because she's starting to think about that kind of stuff.
Yeah.
I love that.
I'll be whispering that to my girls.
Oh, yeah.
Like, then the time clock's
I have a friend
off.
in Telluride who like gifted his daughter with egg retrieval.
Yes. Again, I didn't even know about this. I didn't even know about egg freezing, really. Like, you kind of hear about it, but not really. And then my best friend works at Netflix. They pay for that. And so she was like, oh, I'm getting this done. And I was like, why do you need
That's a
basically,
covered
why do you-
benefit. Like, I'm going to freeze my eggs.
Exactly.
That's amazing.
It's amazing. But I was like, why?
And it's smart for them, too.
Yeah,
they
it
have
is.
someone in the prime of their career who doesn't want to necessarily take the time at that
Exactly.
moment. And
Yeah.
they
It's
can
so smart. But
alleviate that.
yeah, I was like, why are you doing that? Kind of. And she was like, well, like they're paying for it and you might as well. And I was like, interesting. So then that's when I started thinking about it. But no, my age, I think, person did not think about it at all.
Mm-hmm.
And
How old were
now-
you when you did? Did you just do it?
I did it at 35.
Okay.
And then 36, I guess.
But again, and that's natural for you to go like, okay, everyone, like it's ubiquitous and common knowledge to go like, oh, it gets at 35, you're officially in a geriatric.
Like they act like it's you fall off a
Yeah.
cliff
Yeah.
and all that, but it is a steady state.
It's steady. I mean, I had-
the state gets a little,
But I did better the second time, weirdly.
amazing.
But yeah, I wish I had known. I really do. I
Done it
wish I had known
sooner.
so much earlier and just done it and felt
And then
like insurance.
My 21-year-old is not on the radar. She's just trying not to be pregnant and
that's
is
the
living her
problem.
best
I know
life.
you're trying not to
Like,
get pregnant. It's
she
kind of
is like
counterintuitive.
that girl. Like gets to college. My oldest is like by the book, straight A's, pre-med. Da, 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 da. I'm like, go to the party, have fun, come on. I'm like so worried about her social life.
Yeah.
My second one has rolled with 20 kids her whole life. You know, she gets there within October. She's like, I'm out of money. Like she went with her, her summer money and her graduation money. I'm like, what? I check her account. I'm like, bars, beers,
Yeah.
clothes.
That's about right.
Fast food. I go, you have a meal ticket. She goes, I don't like it.
Yeah.
So I'm like,
The fries
you're out
aren't
of
good.
money.
Yeah.
You still have an allowance. I'm not going to let you starve. But she went and got a job and now she's a nanny.
Oh, that's great.
The funniest stories ever is her taking care of other people's kids.
That
I'm
is
like,
so-
these Baton Rouge moms, you know.
Well, that will definitely not get her to freeze her eggs nannying. I will say that.
She is not at all worried.
Yeah, but I do. To any young people, I just really encourage it.
I think a lot of people get a ton out of your book. It's wonderful. The new
Thank you.
Menopause book. And please follow you. What's your handle on Instagram?
Dr. Mary Claire, DrMaryClaire.
You're very cute in your videos. I watched 100 of them today, and they're
Bless your heart.
so cute.
Most
And
no
you're in your-
makeup. Like
she's in her weight
I brought
vest all
glam
the
with
time.
me, and I'm like, no one's going to recognize me. Like, who is this girl?
Yeah. Oh my God, that's so great. And you're doing all these fun things. You mentioned Reese. I know you're doing something tomorrow that's very cool. Love
Yeah.
it. Love it.
We're grateful for you.
Thank
Yeah.
you.
The
Thanks for
women I
having
know
me.
are so grateful for you.
Big time.
Yeah. So everybody,
Big
read the book. Follow you on Instagram. This was awesome.
Thank
We're
you.
so glad
Thank you
we
so
finally
much.
got you.
Stay tuned for the fact check. It's where the party's at.
Hi.
Hello.
Cute jacket.
Oh, thank you. Instagram impulse buy.
Really?
Got one in this color and one in blue.
From where?
Marine layer.
We like marine layer.
Right?
Yeah.
That's a place. Mm-hmm. That's a thing.
Our sweatshirts were from marine layer for a little while.
Yeah, I like this quilted thing.
Yeah. Quilted is nice.
That's what we call. Well, what one's quilted for comfort? The toilet tissue.
Oh,
Charmin?
Charmin.
The quilted quicker. Well, that's a paper towel.
Yeah, that's paper
right?
towel.
The quicker picker. This is Mandela effect. We've created.
Wow.
People are like, do you think there's a product called Charmin's Quilted, the quicker picker upper?
People would say yes, definitely.
Yeah,
Because
and-
it's Bounty.
Bounty, the quicker picker-upper.
But the Bounty doesn't have the same alliteration as Charmin and quicker.
Charmin, quicker picker-upper.
Yeah.
How's your morning?
My morning was good. Every 2 weeks, I get a flower delivery on Friday from Flamingo Estate.
Okay.
And it's really exciting.
It is. You've signed up for a bi-weekly annual sitch.
Yeah.
Do they spice it up? Is it a different bouquet every time?
Yes. So you don't know what you're going to get.
So you have anticipation. What will it look like?
Yes. And it's always from a cool, like, farm.
They find a guy who just has one flower bed in his backyard.
Very limited dish.
Yeah.
Very
extra small micro business.
Today it was ranunculus, and they're orange.
Oh, that's the name of something.
Flower.
Ranunculus?
And they're orange, and they're so pretty. I did lose a little track of time because I was cutting the ends, and I was, cleaning up the stems.
Yeah.
And
Easter egg. We just learned a fascinating fact from somebody. It's a rule in sketch comedy. It's not our rule.
Yeah.
But it's if a man comes in to pick a woman up on a date in a sketch, have him bring chocolates, not flowers. So if you bring flowers, the audience starts getting very distracted.
Well, they got to put them in a vase.
Oh my gosh, she's got to get those in a vase, got to give them in water, and you can't even pay attention to the
I know,
sketch.
it's so smart. These delivery services, they can really brighten your day. I would recommend that for a gift.
Yeah, that sounds like a good gift.
Yeah.
Yeah.
Unfortunately, I did try to gift this exact thing today.
Oh, today.
Today's Callie's birthday.
Oh, happy birthday,
Happy
Callie.
birthday, Callie. And I was going to get her this weekly Bloom bundle.
Right, the gift that keeps on giving.
Yeah, but it's sold out.
Oh, okay. All right.
So I can't.
That's the problem when you go with these micro growers that only have one flower bed in their backyard.
Yeah, they run out.
Yeah, it's a really great idea, but then in practice.
Part of the fun. It's part of the limited dish element.
Okay, so I don't want to say this, and I just really can't control myself to not say it.
Okay.
Because I got to get out of the habit of addressing commenters.
Yeah, I would prefer not because that's why I don't look at them.
Yeah. But I just want to make this simple point because people, they'll Jonathan Haidt will be on. Sweet people like, he's so anti-technology and he doesn't know and it brought people together and blah, blah, blah. Great. But I was just thinking, what I like about our show is we have Reid Hoffman on. He's a techno-optimist.
Yeah.
You get to hear the full sales pitch for why technology is great. And then we have Jonathan Haidt on, and you get to hear the full sales pitch on why it's bad. Mm-hmm. And instead of being like angry at these guests who have a different point of view, I would really wish people would be grateful that they got to hear the counterpoint to what they believe. I mean, that's what I so enjoy about the show.
Yeah.
And guess what? I don't know which one I think.
Yeah.
It's like I half believe what Reid's saying and I half believe what Jonathan's saying. I don't agree with Jonathan.
Yeah.
But I'm so grateful to hear a very smart person
we got to hear
tell me the opposite point of view that I have. And I just wish people could click into that's a gift to hear someone with a different point of view tell you what the opposite side thinks. It's not shut that person down and get them out of here and I don't like what they're saying.
Yeah, I agree.
Now, if we only had one sides of all these debates, I think that would be a pretty reasonable criticism.
Yeah, I agree.
Yeah. I was burning a hole in my... Go ahead.
You know what I'm going to say.
Yeah, I want to hear it.
It might sound disrespectful to the audience, what I'm about to say.
Yeah.
And I don't mean that. I love our audience so much. I love the Armchaires. I'm so grateful that people listen to us. But I don't care.
Right. That's healthy.
If they don't like an episode. I also personally, I don't believe it. I don't believe that what you're reading is indicative of what people think. And that, it bums me out that you get like ensnared.
Well, some woman told me, I need to apologize for saying young men are disenfranchised. And I said, apologize to who? Like, who am I apologizing to?
I know, but this is the
I know. It's really tricky. Now, I'd say the good news is like, I'm not going to change at all what I'm doing.
Yeah.
So it's not like I'm subject to altering how I'm going to invite Jonathan on and invite Reid Hoffman on. It's going to have no impact on how I do the show. I think I have I do have maybe an arrogant, delusional belief I could explain the value of hearing this, and people might lock into it and go like, oh, you know what? I'm going to stop blasting everyone I disagree with. It's okay to disagree with people. You don't have to hate them.
Yeah.
Jonathan's a great guy. I totally disagree with a lot of what he's saying, you know. But so I have this stupid belief I can encourage people to embrace this. And that's my own delusion.
It's a delusion, but you're only seeing like one piece of the whole puzzle.
You're so right.
You don't know who you're even talking to.
No, you're absolutely right. And I do think about that. So like naturally, you and I's debate about men and women.
Obviously.
Yeah, it was very polarizing. I expected that, and that's totally fine.
Yeah.
And I get it. I get it from both. I totally understand from both sides. But yeah, it's like 50 people. You know, on either side, out of millions of people,
it could literally be one person. This is what I'm saying.
Oh, that's got 30 accounts.
Yes, this is my point. Like to get wrapped up in it, your strongest trigger is getting taken advantage of. But when you react like this, I think you've been taken advantage of.
Because I got wound up about it. Well,
and you don't even know. Like,
but what's perfect about it is a facet of this thing I obsess about without the comments.
Yeah.
Right? So your big concern is women's reproductive rights, which makes total sense.
It's a concern, yeah.
Yeah, but it's like a very paramount concern, and rightly so.
Yeah.
And you'll think about that a lot, you know?
If it feels threatened. I don't think about it on a regular basis. But if it's threatened, yes, of course.
And I'm regularly so scared about the inability for people to listen to one another.
Yeah.
I'd like think about it too much. And it really frustrates me and it scares me. I'm scared of the future where there's two camps on the planet and they don't talk to each other.
Can we deep dive?
Yeah.
Why is that so scary to you? Like, of course it's bad, right? Like, I think it's bad too. I'm like, this is a huge problem, but I don't have this reaction that you have. And I wonder, I mean, obviously we know that if anything's like causing that much of a reaction, it's something else. It's something about us or our past or our, like the fear is about us.
Yeah, I guess probably dysfunction. I grew up in dysfunction. I grew up in two parents that hated each other till they got divorced, like dysfunction.
Yeah.
Not rising to one's best self to navigate these things. We have gotten embarrassingly dysfunctional.
Yeah.
And I see the total root of the dysfunction is us against them.
Yeah.
And I see that as such a toxic quality. And I have children that are entering a world and I care about the world for them. So yeah, it really bothers me really deeply because my childhood was plagued by dysfunction and two people not communicating and it's winner takes all. And I hate that situation.
Yeah.
It wasn't compromise. It wasn't working together it was, you know, as I always say, the paradigm everyone needs to wrap their head around is we're married. The left and the right are married. We all live in the same country. And so we have a Gottman approach through this marriage or we have a fucking, what's the famous War of the Roses version of this marriage. And I lived through the War of the Roses versions of the marriages. And so for me, I didn't want that in my life when I grew up. And then when I feel ensconced in a whole society that's way, and then I put out a show and I see people saying, you know, Haidt's a conservative, whatever, like they've just written him off. I think I've said this before, but it's like one time we went out to, and this is a ding, 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 because it came up on an episode yesterday we recorded, but Ted Olson, you know, this, he was the most successful Supreme Court. He argued in front of the Supreme Court more times and more successfully than anyone else. And he, very confusingly, from my perspective, both won Citizens United, which is a very right cause, giving businesses personhood, but he also defeated DOMA. And he believed in both of those deeply. We had a dinner with him, and there was 3 of us liberals and then him. And we started kind of hitting him with all of our points of view. And then I said, hold on a second. We have an opportunity to be with one of the smartest people in the world who has a different point of view from us.
Yeah.
What an opportunity to hear the best version of this point of view that I disagree with.
If you want to look at it in a way that's selfish, it's good to hear the other person's point of view so that you know how to combat it.
Well, you'll find if you combat it, some of their pushback will make some of your points fall flat.
Mm-hmm,
and those are points you need to rethink or jettison or figure out another way. But it's as much as you can learn from them, you also learn the weaknesses of your own point of view.
Yeah.
Which I like. I'm arguing with people all the time and I get to one and I'm like,
yeah.
That's not a good point. I got to get rid of that. And that can't really be a part of my.
I also think you are in a program that requires self-reflection, growth, checking yourself. And so I do think you're extra.
I'm extra.
Hurt. No.
Yeah.
It bothers you more when you see people who aren't doing that or don't care to do it.
Yeah.
But there's just a lot of people who don't. And I guess I respect that bothers you. To me, I think if that bothered me, I would die. Like, that'd be too much. Like, I can't take on that people don't want to change. That's not my job to make people want to change. And, I can only do me.
I just wish everyone thought I'm holding all my beliefs in my hand right now. And they're certainly not the best version of my beliefs. They're going to evolve. Hopefully. That's what they're supposed to do.
Yes.
So you don't have the complete finished version of your beliefs and your points of view in your hand.
People really have a huge problem with wishy-washiness.
Right. They see that as
I've heard that
weakness.
a lot. Like flip-flopping and a lot about politicians. They say that a lot about politicians that, they said this and now they're saying this.
Yeah, if you catch them having changed their opinion.
Right.
Yeah.
I find that so strange.
Yeah, it's really disappointing.
Why can't they should be changing their opinion? It's so weird to me. It's so much worse to me that they would have said something so long ago, felt stuck in saying that, and now they just have to believe that forever.
Yes.
That's a big problem, but both sides hate that.
Yes.
Which I really do not understand.
Yeah.
It feels very backwards, but again, like, I can't get that riled up about other people feeling that way because I can't change them.
But I think you're right. I think this whole thing feels like a dysfunctional family to me.
Yeah.
And I hate it.
Yeah.
And I want everyone to be a bigger version of themselves, myself included.
Yeah.
And it's disheartening to live in a dysfunctional family, which is this country.
Yeah.
You know?
Do you think that it's because when your dysfunctional family ended in pain for you specifically and pain for your mom and pain.
All involved.
Pain for all involved.
The stepdads were miserable afterwards. Their children were miserable.
Because I think not everyone, I'm sure some people are spared this, but there's a fair amount of dysfunction that happens in a lot of families. And I think I also grew up with
some dysfunction.
Dysfunction amongst the adults. But they didn't split up over it. Obviously, for me, having grown up and seeing things I didn't like, I think, well, I can't do that. Like, for my life, I don't want to replicate that. But I also am kind of like it sort of worked out and it's kind of fine. And I don't know.
If I were you, I might want to challenge me by saying, maybe everyone's happy with this, which is also possible, you know? Maybe right now the right's super pumped and they're pigs and shit, and the left is vindicated and validated and feeling even more self-righteous. Maybe everyone's getting exactly what they want out of this. And so that's an interesting thing for me to consider. Like, you're trying to fix something that people will like. As much as
that's true.
They might not want to say they like this, maybe they do.
Yeah.
Maybe the person that's like, Jonathan Haidt's a monster, felt awesome.
Yeah.
And told 9 of their friends they did that, and they love it.
Yeah.
It's hard for me to
I also think people, again, the generous offering is that they want their opinion
to be heard
and seen.
Yeah.
And they want to feel, people just want to feel like a person who exists. I mean, we all just want proof that we exist.
Yeah.
And that is a version of it.
I will watch them exist and validate them without that approach. They don't need that approach.
Yeah.
You know? But I know I sound like, and that's why I said I didn't want to say anything. If I were in that, I'd be like, just, shut the fuck up about the calendars. Just stop reading. I fully get that criticism, and it's true. Mm-hmm. It is true. But yes, it is a perfect little encapsulation of this other thing I spend too much time obsessing about. And if I were really working my AA program, I would just accept this.
Yeah.
I would accept that that's how it is.
There's nothing you can do.
And if someone's attracted to my approach, that'll be appealing to them.
Exactly.
More so than me saying someone should have this approach.
Yes, I agree.
And I should just have faith in that.
Yeah.
Yeah.
Well, it's funny that you brought up hating, because on my ride here, I was listening to a podcast and they were talking about Meghan Markle, and they weren't saying that they hated her, but they were saying like there is this like vitriol around her, and there is, and it was it was interesting because it did make me think
people really dined out.
They like
on her show.
Oh yeah, but people like really hate strangers. Like it to me, that is so interesting. And then I was thinking, I was like, who do I hate?
Well, I think we're hardwired to do it right. We're hardwired to extremely punish someone who has values and morals outside of our in-group and make a emblem of them, right? So I do think when someone represents some, I don't even know how they articulate why they hate her, but she's interesting though. I have a story about this, but I want you to expound more.
No, I was just going to ask if you hated anyone.
When they first, when you were going to ask if I hate her?
Hated anyone.
Oh.
Because I was like, when I really think about it, I mean, I don't hate any strangers, and even people in my life who I like, who I do have like friction or cause stress.
Yeah.
I don't hate them. Like, I don't think I hate anyone, actually.
I hate a couple people in public. I hate Tucker Carlson.
Right.
I just think he's a smug bully. I don't even really give a fuck about his politics. It's just the smug bulliness about it.
Yeah.
Is there anyone else? Like, I'm trying to imagine. And if you're saying you hate them, you have to take it to the, like, literally you hate them to the degree if you saw them in person, you'd go, you're a fucking asshole.
Yeah. Yeah.
And so I think the only person I can think of him that if I met him in real life, I'd go, you're a fucking piece of shit.
Right.
Would be him.
Yeah, I feel like I remember one time years and years and years ago, probably when I was babysitting and we were playing games and stuff, Catan. I think I said something like, "Ugh, I hate this," and you said, "You say hate a lot."
We've talked about this before.
Well, it's been a minute, probably.
Yeah.
I was saying it just as a random word, really,
as an adjective.
Yeah, it didn't carry the weight that it was carrying for you. But then I was like, yeah, that is a big word to be sort of throwing around.
Yeah.
And I think I don't really say it as much.
No, not at all.
Yeah.
Yeah. I think I used to say it too. I think that's one of the aspects of my point of view shifting of moving to California that I liked a lot.
Yeah.
I think when I was in Michigan, I had a very long list of enemies. People we hated.
All right.
A lot of people we were against.
Interesting. Wait, back to
back to Meghan Markle.
Yeah.
So I didn't even see it, but I saw some of the Oprah thing. Their very first interview, right? And a friend of mine from England let it rip on her. Like, can you fucking believe this? Blah, blah, blah. Like, just outrage, right? And this friend, I really respect. Their intelligence, their empathy, the whole thing. This person's a very admirable person.
Yes, I agree.
And so I had to really force myself to imagine how could he have this strong of a reaction?
Yeah.
And the scenario I painted in my head was, and I think I've already told you this.
Yeah.
When Obama was in office, a Russian kid comes to the DC, falls in love with Malia, takes her to Moscow. He and her go on their biggest television show and shit all over Obama and accuse him of being racist and just trash the country under the guise of this Russian dude. And I was like, yeah, I would fucking hate that guy. I would absolutely hate him. And there's a layer of patriotism that has to be acknowledged that we all carry. And if I do think of that scenario, I just know I would hate the Russian guy who took Malia to Russia for the rest of her life and they go on TV all the time and shit on America. I would hate that guy. I don't understand the Americans who hate her so much, but I do understand the British backlash. They took the prize son. They all liked him more than the other one.
Right. But taking is so like he didn't have a mind of his own.
Oh, I know.
I mean,
But then I'd be saying Malia doesn't have a mind of her own. But if Malia left with this Russian dude,
made the
never
choice
to return.
I mean, yeah.
And then went on Russian television and shit on America.
But
I'd hate the whole scenario.
I guess, I don't know. I don't know that I would. I think I would be like, yikes. She like,
no, but
she
him,
had
you got to
a bad
evaluate him. You got to evaluate the dude.
That's the part I actually can't relate to. Like for me, Harry made a choice about his life and his family.
Yeah.
And I don't see it as this woman like took him away. A
siren who called him to the rocks of America.
Exactly. I see it as a man who made a choice based on a lot of things, including the death of his mother. Yeah. And so I don't have a problem with him being like, there's a lot of fucked up shit over there and I had to leave it.
But I think we have clarity on that one because we don't have the in-group patriotic bias.
True. But I think if Malia left and married this Russian person, and then they went on Russian TV and they were talking about it and she was saying like, look, the White House was horrible and the media in America was horrible and this is what they did and this is what happened.
But really quick, I'm not talking about Harry and Meghan.
Right.
I'm talking about this theoretical Malia and this guy.
Yeah.
I would go, oh, you hate the media? You're on the biggest fucking show in Russia. You can't hate the media and then willingly participate in their biggest media outlet.
Well, they hate the media.
You're such a fucking hypocrite.
Well, no.
That's what I would say to this imaginary people who's on the biggest media outlet in Russia complaining about media attention.
But I'm saying they speak specifically about British media.
Tabloids.
Yes, and we have had enough people on who have corroborated that the British
I want to be clear.
tabloids.
I understand why. I am not, none of this opinion is about those two.
No, I know,
This is my, but I do have strong knee-jerks about this theoretical defecting of Malia to Russia and being on TV, complaining about being on TV.
I guess I don't. I just don't. Like, I think if they were like, because we have to make it equal. I mean, look, we have obviously media issues, but it's not the same.
Well, let's just say it's the scenario I painted is actually less impactful than the one that really happened because Malia was never going to inherit the presidency.
Yeah. Well,
Harry could inherit the kingship.
No.
Yeah, his brother would have to die.
No, then it goes to the son, William's son. Harry can't be the king.
Okay, when the son dies, he could be the king.
Okay, it's
There's a long list.
Yeah.
Okay, would they give the kingship to a 7-year-old? I don't think.
Yeah, like
I want to do a little digging on this.
Joffrey.
There's no inheritance in the presidency, so the scenario I'm painting is even less impactful.
I agree. I mean, that's why we don't. It's like hard to make this equivalency, but also like. Why should he possibly stay in this thing that he sees as fucked up?
Oh yeah.
Like I don't know. I just commend.
But an outsider came in, and then the beloved person left, And that's easy correlation to get upset about.
I mean, look,
maybe Harry would have defected on his own without a wife that was American.
Mm-hmm.
That's possible.
Yeah.
But we don't really know because it didn't happen that way.
But we also, you know, more than anyone, that like if you're in love with someone and people around you are not treating that person well.
Yeah, you got to protect them.
You're going to protect them and you're going to ultimately say, fuck this. Like, this is a problem. We're going to go now.
Yes, but so I already agree. I understand why he left and I would have left.
Yeah.
1,000%.
You're just saying you understand why people don't like it.
I
and
totally
I
understand why people
too.
don't like her that are English.
Right.
It's not hard for me to understand.
It's not hard for me to understand. I do wish they would take a second look at it. Like, it doesn't affect them. It really doesn't.
Well, they lost their cutest royal family member.
Get over it. Like, I mean.
And I hate royalty.
Yeah.
But I understand something you value getting, quote, taken from you. Not even say taken. I understand losing something you value. So it's like they do value that. I can't understand it.
No, sure.
The notion of like
I actually
royalty.
can understand that weirdly.
Right.
I
you
can
like
buy
royalty.
into the royal family and thinking that's cool and that's a part of your history. And I do get that.
Yeah.
Even that, like even feeling that way, I don't think I would feel personally injured by one of them going to live their life. I think differently. I think people don't like her because they think she's fake. People think she's fake. People think she's mean, but she pretends to be nice. Like there's a lot of, and then with the new show, they're like, what is this? She's just moving pretzels from one bag to another bag. This is stupid.
I don't know that reference, but I'm laughing right now because the description was really funny. Meghan Markle, I didn't see that, so I'm not laughing at.
You know what? I'm not laughing either because it's clear that she does like it. It's not, I don't think it's fake. It may seem ridiculous to someone who's like living a life, going to work and having to come home and then turning
living
that on.
Living paycheck to paycheck.
Exactly. Turning it on and seeing that her day is spent moving pretzels from one bag into another bag.
Well, now I really want to watch this episode.
It's like, that's a very simple explanation. She's having a guest over and she's gonna put together this like cute little tray by the bed for the guest that has like flowers and stuff. And then she like buys these pretzels, I think with peanut butter. They look delicious.
Okay.
And she put them in she took them out of the bag. She put them in another cute little bag and put like
so you've watched it.
Yeah. Oh yeah. Yeah. And put them like, wrote peanut butter pretzels and like tied it up. Made it cute.
Cute font, yeah.
She made it cute.
Yeah.
And I think that does bring her joy.
Yeah, sure.
I don't think that's a lie.
Right.
And so it's kind of what we talked about before with the podcasts, the like men's podcasts and stuff.
Yeah.
If you don't like it, just don't watch it.
Yeah.
If you think this is sort of offensive because your life, it's not reflective of your life.
Stay tuned for more Armchair Expert, if you dare.
I bet the core thing that people are triggered by is like, why does this woman get a show about the things she likes?
Yes.
Why don't I have, why would I actually build birdhouses?
Right.
I actually do X, Y, or Z.
Yeah.
And I do think it's easy to think in some abstract way, she got something that you deserved more.
Right.
As if her thing took from you.
Yeah.
And that in general, people who don't deserve things are taking opportunities.
Yeah.
That should go to deserving people.
Right. Yeah.
You can quickly get into some very large moral imperative stuff.
Well, yes, because who deserves anything? Like do we inherently, we deserve like dignity.
Uh-huh.
But to me, other than that, we as people don't like come out deserving of money, or I don't know. It's a weird thing.
I'm yes and no.
Yeah.
Yes and no. There's like a nihilist version of me that I can tap into pretty easily, which is like, who's kidding who? We're all staying busy on this circular globe until we die.
Yeah.
There's no God. There's no one is evaluating what should and shouldn't and better and worse. Like we're just all distracting ourselves in the most entertaining fashion we can manage until we're dead.
Yeah.
So there's that version. What's like, yeah, what are you talking about? You don't deserve, you deserve, for 300,000 years, you deserve to come out without clothes on and be ill-equipped for this world. In the best case scenario, you ate and had a kid. So the notion that you, at some point, a TV show was a human right.
Yeah, exactly.
Or a cell phone's a human right. Or I hate to say it, that healthcare is a human right. These are all really, really incredible modern privileges.
Yeah, they're advanced privileges, yes.
Okay. And now also on the other side, yes, Brene Brown deserves a podcast more than a lot of people because she has spent a good chunk of her life acquiring knowledge that is useful to other people.
Yeah.
And yes, she does. I would have to be lying to say that the guy in front of 7-Eleven who's repeating the same sentence over and over again should have the same level of success on a podcast that Brene Brown has. I can acknowledge some people do deserve the success more than others because they've put more effort into it and they have more dedication and they have more skill. Jordan deserves his 6 titles more than a lot of the players. It's not like everyone who entered the NBA deserves 6 titles. You know?
I just mean we don't all deserve to be a basketball. That's my whole point. We don't come out deserving everything.
Right.
We have different skills and privileges and things that allow us to like live the life we're gonna live. But I don't know that we deserve. Like I don't know that Brene. I mean, of course I love her, so I think she deserves.
Yeah, we're biased.
Yeah, but the 7-Eleven guy, if
his one sentence repeated over and over again.
If it is one sentence repeated over and over and over again, has a massive impact on people.
Yeah.
And it changes their life and it like makes them think about the world differently. He deserves it.
Absolutely. But what I think is even more interesting is so I feel that way about that topic. But what I can admit and acknowledge is there's another scenario you could paint that is the same principle at hand.
Mm-hmm.
And I'll go the other way.
Yeah.
I think that's what's much more fascinating and more fun to pay attention to is this illusion that I have a consistent policy.
Yeah, exactly.
And I don't.
Yeah, none of us do.
And what really happens is I look at the person and generally I like them or I don't like them on some weird gut level. And I'm generally accepting of the things that people do that I like. And I'm critical of the things from people I don't like.
Yes.
And I frame it under this well thought out logic I have.
Yeah.
And it's just so inconsistent that I have to acknowledge.
Yeah.
There's a lot of going on.
I do think so much of dislike, though, is jealousy.
Oh, yeah.
In general, and for all of us. If we dislike a lot, not always. Of course, there's like people who do horrible shit to other people.
Yeah.
You're going to dislike that. But like when you're just like irked by someone who you don't know.
Yeah.
It's probably because there's something that you're triggered that you wish you had, or I mean, again, this thing she's presenting is perfection, right? Like she's able to make her own honey. She has this bee farm.
She has her own bees?
Yeah, she has her own bees, and she makes her own honey, and then she makes these like.
Have I told you bees have rebounded?
Really?
Yeah.
Really?
It's like great news. Remember that panic we were all in? They've totally rebounded.
Because of her.
Perhaps.
Oh my God.
So we all are a debt of gratitude.
Wow. That is good news.
Yeah.
But like she makes her own like raspberry preserves and like because she has a raspberry bush. And so people are like, I want a raspberry bush and I
want to spend my day doing this nice fun stuff.
Exactly.
Well, there's probably that. And then there's also Martha Stewart.
Yeah.
There's Martha Stewart who has spent her entire life really becoming a master at all these things.
Yep.
And then she has a show, and by God, it's very, very helpful and useful to people because she's a master.
Yes.
And so if you're comparing these two people and they both have a similar size show, I can understand people being a little frustrated.
Right.
It would appear that one person really is now benefiting from their dedication and love for their whole life.
Yeah.
To something. That's a good story.
Yeah.
Versus like, and I could do this. I'm not a good woodworker, but I bet your ass I could sell a show to Netflix tomorrow about me with a wood shop building things.
Yeah.
And if I was a master woodworker, I'd be like, this is bullshit. Why is it? And that would be fair. And also, if I want to do a show about woodworking and I think it's fun and people are interested in it, why can't I do that?
Exactly.
So I think all these things are true. So Kristen came home to me and she said, oh my God, I got like 5 texts from people. Like they were salivating to share this news about Meghan Markle's show. And she started calling people out. Like, it seemed a little too excited about what you determined was a failed attempt by somebody. That's like if you're taking a lot of joy out of a failed attempt on somebody, is that who you want to be? Is a bigger question.
Exactly.
And I also think it's worth delineating because I'm critical, as you know. I'm trying to shut the fuck up about it, but I am critical of people that are allowing someone to make them miserable. As I've said,
Circles back to
it's like
what I said earlier.
2016 to now. If you've been miserable for 9 years or an hour of your day is spent in anger, I just think that's a rough use of your life. Now, if you're seeing the Meghan thing, and you're excited and you share it with your friends and you all gossip and you all have a good time doing that at dinner, I guess I'm not critical of that in a weird way. I feel bad for the subject of the ridicule, but I also can just, again, in a utilitarian way, look at, these 5 people had a really fun dinner for 2 hours gossiping, which is an adaptation of social primates. Like, we're wired to do it.
Yeah.
I guess I also can go, okay, you guys had fun shitting on somebody. Everyone felt better for some reason about themselves.
I mean, that's the part
that's a bummer.
Yeah.
But if the end result was you all did that versus you all got together and you like, this motherfucker, and I can't believe this. Yes, outrage and feeling defeated and overwhelmed and all that. I weirdly have a distinction between those two things.
Yeah, one's harmless and the other one is causing harm, personal harm to them, the people who are doing it. And I mean, I do think it's a privilege to be Kristen or be me. And I'm like watching this, I'm just watching the show and I'm like, oh yeah, like.
I want that bag.
I'm like, oh my God, like I should order some of those tomatoes and make that.
Because you're not frustrated with the outcome of your life.
Exactly. Yep. I am not like, well, why does she get to have that?
You have plenty.
I think I have plenty.
That's right. That's right.
I have more than I should have.
That's right. And I do too. And I'm not as bothered by a lot of things that people are bothered by. And I know it's a privilege. What is so tempting to try to tell people is it is a product of your own. You think this person's objectively one thing.
Yeah, I know.
It's helpful to understand, no, if my cup was full, actually, and shockingly, I wouldn't feel the same way.
I know.
And you kind of want people to know that. Because I think it is helpful for development, which is like, my opinions of things are dramatically impacted by how I feel about my own self and my own outcome.
Yeah.
And I would probably be best served trying to love this version of myself enough that I don't feel anger when other people
are doing well. Real quick facts. This is for Mary Claire Haver. Great episode.
Solid.
My assumption is it's
get that topical vaginal cream, everybody. Go out right now and just start smearing it all over.
She posted about it.
She did?
Uh-huh. Aww. It was really sweet and cute because it was out early. And she said she had a good time with us.
Can I Easter egg that I got the text of my life last night that I shared with you guys?
Yeah. We can't say anything else.
I urge people to hang on to the show a little longer. I know a lot of people are thinking about quitting, but just hang out for a couple more months. Wow. I'm going
to have to get a facial.
Hard as a rock. I'm going to have to jerk off before the interview so I can last during the interview.
Yeah, same.
Yeah.
I'm going to have to wear really strong pants, not ones that can explode.
You're going to have to be in fucking steel trousers.
Woo.
Might want to go short skirt. I say you go all the way. If ever there was a time to take the biggest shot of your life, you might want to go skirt,
bra top,
braless, see-through top.
I do have a new top that is pretty see-through.
Oh my God. And if you did, and this person's a fashion icon, so they would just be like, oh yeah, fashion.
Oh my God, I could maybe get away with it.
I think you should go.
You'd have to blur it, Rob.
Oh, they could.
Yeah, that could
on
be done.
YouTube.
Yeah, no problem.
But
for him,
or
her,
or her,
whoever our guest is. Wow, I can't wait for that. That's an even more fun element to think about. Is coming.
How I'm going to show up.
Yes, and how aggressive you'll be. And I just want you to know that I am encouraging you to go above and beyond the realm of what you think is tasteful. And you'll be sitting directly across from this person?
Yeah, but my instinct is to just like play it so cool.
No, go for it.
I know. I don't know.
On your deathbed?
I think this person might be more intrigued by someone playing it so cool.
I don't think so. Let me give you some inside baseball on guys.
Yeah.
There is no guy who's going to see a rockin' bod on display and think, not for me. I mean, there'll be no straight guy who thinks that.
Yeah, Jess says he's starting to turn. The more he hangs out with me.
Oh my God, so you guys might end up
together after all.
What a great time. And then you guys bring back Monty and Jess love boys, but it's like Monty and Jess are married.
Oh. That would be that'd be boring.
Well, no, you'd be fighting.
True.
All this fun you're having would quickly turn to fighting.
True.
That could be entertaining.
Oh, man. Anyway, okay, well, that's TBD for people.
Yeah, that's exciting.
Okay, some facts. Okay, Rob, can you help me? What did you type in to get the names of those guys who did the WIH study?
I looked at Dax's notes for the episode and saw what he wrote down.
That is, I for the life, I was trying so many ways of typing this into Google, and I can't. That's not coming up for me.
Yeah. Do you want me to spell it for you?
Splablowski?
Yeah, let me find it again.
Splablowski and Travawski.
CHLEBOWSKI.
Chlebowski.
And ARAGASKI.
Okay, so these are for the Women's Health Initiative. This is who you say was a part of the study, and this is who...
I could be conflating. I just want to be clear. The stuff I was saying that both Atia and Lane Norton are all over is Chlebowski and Eras.
Okay.
They're the ones that keep doubling down on this bad data.
Okay, so maybe they've doubled down, but I don't think are part of the original study.
Okay.
Dr. Bernadine Healy. This is in 91. She was the female director of the NIH, and she announced her plan for the Women's Health Initiative. There was a ton of people involved in this. And it was a 15-year study. I mean, and it was wrong.
Yeah. It was not right.
It was not right.
And led to a mass panic.
Okay. Now, peak suicide rates for women. Female suicide is concentrated in the 35 to 64-year age group. That's 64.8%.
I don't know why that's so weird for me. I mean,
I get it. I get why it's weird. I wouldn't have expected
weird,
that
but
either.
obviously we were just given the explanation, which is menopause. But it is, it's just not the time. You think that's the time of your life you start fully accepting who you are and what reality is and start transition. Yeah.
But it's those hormones, brain changes, scary. But good to know, like if you're starting to feel.
Yeah, that when you're in the danger zone.
Yeah, exactly.
Higher to the danger zone.
Okay, now male pattern baldness.
MPB. I say one thing?
Yeah.
I was eating at a restaurant this morning.
Uh-huh.
With Nate.
Uh-huh.
He left. I paid. Woman came over to the counter or to my table. Mm-hmm. And she said, I just want to thank you for the Blaze episode.
Oh.
I have BPD.
Oh my gosh.
And I think that episode probably saved me like 2 years of my trajectory to dealing with this.
Great. So she realized she had it because of
No,
this?
I think she already knew, but hearing from him something he did, she's like, it just kind of like fast forwarded her 2 years in the process.
Amazing.
And it was very good for me to meet her because I think a lot of times you're like, BPD, they fuck up the person's life who loves them and you villainize them. And it was very helpful to look at this young woman who's so grateful for help for this thing she doesn't want. Yeah, I was very happy to.
That's lovely.
Yes.
Yeah, I like
So
that.
fucking good luck, BPD survivors.
Yeah.
Yeah.
Wow, it's the first time you've ever said survivors. You don't say survivors.
I don't
a
like
lot.
that term.
I know.
Yeah.
It was like the most PC you've ever been.
Yes.
Okay.
Okay.
Male pattern baldness doesn't exclusively come from the mother's side. It can be influenced by genes from both parents. The AR gene is located on the X chromosome, which men inherit from their mothers. However, other genes and environmental factors also play a role. If your mother's father has male pattern baldness, you're more likely to have it too. If your father is bald, you're twice as likely to have it. Hormonal fluctuations, nutritional habits, stress level, and lifestyle choices can impact the onset and progression of baldness. Yeah, genetic factors from both parents significantly influence the likelihood.
I'm fighting for my life.
You're doing fine.
I think I'm doing fine in the battle, but I'm fighting with all I got.
Oh, I see. I see.
It's morning and night, that fucking topical that I hate. I hate how it makes my hair feel.
Yeah.
I got to hold my head back so it drips back. It's embarrassing to see me at night in the mirror dealing with trying to keep my hair.
Do you want to do that thing that Ike did?
What did he do?
The PRP?
Oh, I don't believe in it.
Oh, okay.
Yeah.
Great.
What I really want more than anything is for them to figure out how to clone hair. And I want to go in and get my hair cloned and have massive surgery.
Oh.
And get the thickest lion mane head of hair and have long braided hair.
Oh, my
like
God.
a Viking.
Oh,
And
wow.
maybe I'll be in my Viking outfit for our guest and you'll be in your outfit. And we'll let the chips fall where they may.
We'll both
Maybe I'll be wearing a kilt and I'll be
topless.
I'll be in a kilt crossing and uncrossing my legs repeatedly.
Okay.
Yes.
Oh, we're going to be competing.
Oh, this is great. Here it is. So in 1970, we're doing
This
the river
poor
dance.
guest.
I know, this poor guest.
Oh my God. Okay. And then, real quick. So she said that there are places that you can donate your eggs for free and keep some.
Yeah.
So that's cool. And there's one place called Co-Fertility that does this. I don't know if this is the one she was talking about. I can't endorse this. I don't know much about it, but it is one of the places.
It is something that came up in a Google search.
Yes. If you'd like to look into it, that's a place. All right. That's it for Mary Claire. Thank God
was
she
awesome.
came in. She really rattled me.
I'm going to use another word I don't like.
Say it.
I'm on a roll. She's a rock star.
You don't like that?
No.
I feel like you say it.
Oh, no.
Oh. Okay.
Yeah, sorry. The list is long. It's hard to keep track of all the things. Atelier, artisanal, rock
Oh my God.
star.
Atelier. This past weekend.
Cuck. I hate the word cuck.
Oh.
That's a thing that like aggro dudes use to try to emasculate other men. They call them a
Because
cuck.
like cuckold.
Yeah.
Oh, weird.
Yeah.
Last weekend, I was doing a long walk. I walked down Sunset. I was doing this whole thing. And I passed a new coffee shop. And I went in and I tried it. And I texted Rob and I asked if he had tried it yet. And then he went the next day and he reminded me there was a merch there that said Atelier on it. Did you buy it?
No, I almost did.
Yeah.
To put in here.
Yeah, I know. I considered it too.
Should we have a
get
t-shirt
it?
that says Armchair Atelier?
I've been saying that.
Yeah, I was just repeating what you said. Just doubling down on what a great idea that you had.
I've been saying that.
Hey.
Okay.
All right, love you.